SDPB shares the voices and experiences of South Dakotans, preserving our stories, our culture, and our sense of place. SDPB, good, useful, and full of wonder. As South Dakota's public media network, SDPB serves everyone with transparency, integrity, and commitment to open access. Good, useful, and full of wonder. SDPB.
It's too late. House Health and Human Services will now come to order. Madam Secretary, please call the roll.
Representatives Rayfelt, Fosness.
Here.
Halverson.
Here.
Jordan.
Here.
Garcia. Excused. Emery.
Here.
Andera. Excused. Kaiser. Here. Schaefbauer. Excused. Manhart.
Here.
Baxter. Here. Heineman.
Here.
Mulder.
Here.
We have a quorum, Mr. Chairman.
Thank you. Good morning, everyone. Just a few reminders, of course. Please remember to silence your cell phones. If you wish to testify, please sign in electronically on your phones or by the iPad over with our pages. If you have a handout, please distribute it to our pages and they will pass it out to the committee for us. And as we're talking about the pages, why don't they come on up, introduce themselves. Let us know where you're from, what school you go to, where you plan to go to, and then this morning we want to know your favorite Marvel movie and why. Here we go.
My name is Alex Smith. I'm a homeschooled senior from Sioux Falls. When I graduate, I plan on going into law enforcement. And my favorite Marvel movie is probably Ant-Man.
Do you have a favorite lobbyist here?
Probably my dad.
No, exactly. That's the right answer.
I'm Michael Johnson. I'm from Caputa. I plan on going into Forest Service, and favorite Marvel movie is, I don't know, like Iron Man 1 or something.
Perfect. Thanks for being here and helping us out and run smoothly. All right, with that, the plan is to take the agenda in order. That's been posted, so we will start with House Bill 1199, address pre-authorization requirements for certain healthcare services and utilization review requirements for certain health benefits. Proponent testimony, Representative Rayfeld.
Good morning, Mr. Chair and members of the committee. My name is Taylor Rayfeld, and I'm a representative in District 14. I do have an amendment that I would like moved at this time. It is a significant amendment, 1199B.
And it's posted, obviously?
It is.
Okay, we have a motion for 1199B from Representative Faustus, a second from Representative Heineman. All those in favor of adopting 1199B will say aye. Aye. Opposed, nay. 1199B, as amended, go ahead and speak to that bill. Thank you.
Thank you, Mr. Chair. Well, House Bill 1199B, as amended, represents a compromise between healthcare carriers and the related healthcare organizations and their medical provider counterparts. For the past 2 years, gold carding bills, or bills that allow certain providers to forego prior authorization requirements upon achieving a preset level of prior authorization proficiency, have been introduced. This compromise does not achieve all that a gold carding legislation would have, but it does mark a significant step in that direction. House Bill 1199, as amended, requires the reporting of data concerning prior authorizations to the Division of Insurance, who will evaluate the data and produce a report detailing the raw data on prior authorizations. The bill also requires health carriers and utilization review organizations to evaluate whether certain procedures and services justify continued prior authorization requirements. This is meant to be a patient-centric bill where those prior authorizations are not becoming a barrier for patient services. Thank you.
Thank you. Further proponent testimony for 1199 as amended.
Mr. Chair, committee members, Doug Abraham. I'm an attorney from Pierre, registered lobbyist for the South Dakota Association of Specialty Care Providers. I think maybe the easiest way to do this is to kind of go through the mechanics of the bill and what it does and what it doesn't do. So the last couple of years, as Representative Rayfeld indicated, we had what was referred to as gold carding legislation. Gold carding legislation gives essentially an exemption to certain providers once they hit, say, 90% of prior authorization on their first submission on any given procedure or for facilities on those procedures. So this is a different step. This is a step more on doing kind of the backgrounding on that. What this does is it requires those entities to report. And if you look at section 1, reports the number and percentage of those prior authorization requests that are approved, denied, and the time periods that they are pending review. And so it gives an average and median time that elapsed between those submissions. So this is kind of the background on what we were looking for purposes of gold carding to begin with. It evaluates essentially whether there's a problem in a given area and gives us the data so that we can evaluate whether, say, give you an example, if you had a procedure relatively, colonoscopy is a great example, everybody loves them. But there's typically very established standards for that. If you're 45 or older, most health plans provide that you can have one every 5 years as a screening mechanism. Still requires prior authorization. Now, if a particular facility is getting, say, 98% approval on their prior authorizations for that procedure under what was the gold carding, then you would have not been required to do that for the next period of time as long as you met that same metric. Well, this will now report that and then give us the tools to evaluate whether or not that's necessary. And the real functional aspect of that, although there's not a lot of teeth to it, but the functional aspect of that is when you look at Section 2, those utilization review organizations or health carriers then are required to review each healthcare service for health benefit that health benefit plan requires prior authorizations for, and essentially self-evaluate. They take a look at, just as in the example I provided, if you're now getting 98% and we still require prior authorization for that, or if it's for a type of genetic testing that's necessary for diagnosis, and you're getting 98, 99, 90% prior authorization approvals immediately, then they need to evaluate and determine whether that makes sense. And that's really what this does, is it promotes entities, providers doing good care, but it also promotes those facilities and the health carriers to really take a look at whether this makes financial sense. Because our issue initially with gold carding was we were having large swaths of our operation suite time where we were not filling those, not because we didn't have a backlog of individuals that were trying to get into those facilities, but we would have issues concerning prior authorization, which would lead to spotty filling of those facilities, and we had folks who'd been waiting for a period to get in. So this is the hope is that we'll have greater efficiency as in that situation, and this will allow those organizations to essentially self-correct if there are particular things that don't make sense for them, because it costs everyone on both sides of this money. If we're doing prior authorization, it costs hundreds of hours per providers, either nursing staff or other staff, to secure these prior authorization. We did initially bring this as a gold carding bill and then went to work with industry. I want to really thank the health carriers and everyone who is interested in this and working with us. This is a bill that really finds its nexus in Iowa. Iowa passed one that's very similar to this. We've modified it for South Dakota. It allows some of those health carriers that have crossed over state lines in dealing with this issue from a compliance standpoint to deal on basically common footing, so they're not reinventing the wheel for South Dakota. But this, we think, is a significant step in the right direction and will give us the data to evaluate whether this is truly an issue or not. So we'd appreciate your support, and I'll stand by for any questions. Thank you.
Thank you. Further proponent testimony for House Bill 1199 as amended.
Good morning, Mr. Chair, members of the committee. My name is Justin Bell. I'm an attorney from Pierre, and I represent, Fort Pierre, and I represent the South Dakota State Medical Association. We were strongly in favor of the original gold card legislation prior to the amendment. The gold card legislation is supported by the American Medical Association around the United States. I would tell you from speaking to my members that utilization review is a significant issue. It's an access to patient care, a barrier for access to patient care. We do stand in support of the amended version as well, although certainly not as helpful as the original legislation would be. It's an important step in the right direction, and based off of that, we would ask for your support of this legislation as amended as well. Thank you.
Thank you. Further proponent testimony for House Bill 1199.
Good morning, Mr. Chair, members of the committee. Dylan Wheeler here this morning on behalf of Sanford Health Plan and Sanford Health. Here today in support of 1199B as amended. We initially did oppose the initial version of 1199, but as Mr. Abraham attested to, I want to thank all parties, proponents and opponents, for coming to a middle ground solution on this complex policy issue prior authorization. And 1199B does represent that middle ground. It's that incremental first step to understand the foundation of prior authorization in South Dakota and see if there is an additional step needed. As an integrated health system and health plan, we do recognize that balance, and balance that is needed. And 1199B is that balance. So I ask for your favorable support. Thank you.
Thank you. Further proponent testimony for 1199. Ms. Clement, we said proponent testimony for 1199.
Good morning, committee members. Melissa Clayman with Wellmark Blue Cross and Blue Shield. We do rise in support as 1199 as amended. We're committed to safe, affordable, and quality health care. We'll stand by for questions, and I promise I will register as well. Thank you.
Further proponent testimony for House Bill 1199 as amended. Proponent testimony? See none in the room. I don't believe we have any online. No. All right, with that, we'll move to opponent testimony. Just as a reminder, I am timing proponent and opponent testimony at 12 minutes. We had plenty of time there, but just a reminder for the rest of our bills as well this morning. Opponent testimony for House Bill 1199. Seeing none in the room and none online, we will move. No need for rebuttal. We'll move to committee questions. Committee questions. Representative Baxter.
Thank you, Mr. Chair. Question for Blue Cross Blue Shield. Apologize, I didn't get her first name.
Melissa Klein.
Thank you, Melissa. Just a quick question. So could this potentially have higher insurance costs to consumers and employers and maybe additional out-of-pocket costs to the policyholders in any way?
Go ahead.
Excuse me, Melissa Clayman, Wellmark Blue Cross and Blue Shield of South Dakota. As the proponent indicated, this is something that passed in Iowa last year, and so we are preparing those reports right now. And so we see this as a commitment and a first step, and so we hope there's no costs.
Okay.
Sure.
So could there be a risk of overuse of this, potentially treatments that may not be necessary, and then just a potential strain on healthcare resources because of ordering a lot of extra tests potentially?
So Wellmark does use prior authorization as a tool to manage those costs. We do not see this bill as passed as changing that process. It would give us the ability to evaluate, to self-evaluate, as the proponent indicated, to make certain that we are using prior authorization appropriately. So no, we do not see that this is going to cause additional tests that are being ordered under this bill.
Further questions, Representative Bandera.
Thank you, Mr. Chair. For Sanford, if Sanford is here. Thank you, Mr. Chair. Does Sanford know exactly how much money annually is lost in prior authorizations that either, the insurance companies say that, well, you didn't do it the right way, or you did it prior, or you did it after the service was actually given, so therefore it's null and void? And do you see that this piece of legislation is going to help with that?
Mr. Chair, Dylan Wheeler, Sanford Health Plan. Representative, I think a little perhaps of both. Maybe on the health plan side to start with. We do see a number of unnecessary prior authorizations submitted where prior authorization is not required. So our staff time is used sometimes looking at things that we didn't require prior authorization in the first place. But conversely, too, we do have gaps sometimes in our own process in processing those prior authorizations, whether it's not a complete review of the medical record was submitted or things like that. We really take a hands-on approach from the plan and provider side to reconcile any errors in the prior authorization by picking up the phone, having a peer-to-peer consult, anything we can do, and just remember that there's a patient and a member at the end of that decision, and it does us both well to do that in an expedited and efficient process. So this bill represents a first step for us as a health carrier to understand our own processes and if there's room for improvement, but alternatively too, if there's some things on the provider side too that can make this process more efficient, that's where that balance is. So a little bit of both.
Okay, thank you.
Thank you. Further questions, Representative Schaefbauer.
Doug. I know there's limited amount of insurance companies in the state, but do all insurance companies that are here in the state have to opt in to this, or can they choose not to utilize this?
Mr. Chair, again, Doug Abraham, South Dakota Association of Specialty Care Providers. If you're a health carrier licensed in the state, you're going to be required to do it.
Further questions? Representative Heineman.
Thank you, Mr. Chair. For Mr. Abraham, maybe digress a bit in the question of authorization, prior authorization. And again, this is not a trick question. I'm curious to know the question of prior authorization is in code. We're dealing with code here now, and why is it in code? It seems to me that the question of authorization, prior authorization, should be in the medical field. Do you understand what I'm saying? It seems kind of odd that, and I suspect, my question is, especially for me, why are we determining this based on our South Dakota code?
Mr. Chair, again, Doug Abraham. Representative Heineman, I guess I would say that this is nothing new. We already deal with, if you look at Chapter 5817H, where this is going, we have utilization review and benefit determinations. There's an entire chapter of the code. I suspect that came out of just putting up guardrails and standards for both sides, both insurers and patients. So there are expectations and an enforceability aspect to that with the Division of Insurance.
Thank you. Further questions from the committee? Seeing none, we'll move to action and/or discussion. Action and/or discussion. Representative Schaefbauer.
I would just like to comment real quick. I think this is a good step forward for patients. On a personal level, this pre-authorization is really kind of a pain when you know you are going to have a procedure every year or a MRI every year because of some past medical history. And so when you know that you have to wait for the authorization, even though it's going to be planned once a year, I think this is a good step towards just giving patients, there's a little stress in knowing, is this procedure, which I need, going to be pre-authorized every year? And so I think this is just a good step forward. So with that, Mr. Chair, I move do pass.
Second.
Well, unfortunately, in the House, we're not allowed to have comment first. So action. Can we have
I move do pass, Mr. Chair.
All right. Representative Andera moved do pass. I believe I have a second from Representative Fosness. Comments on that motion, Representative Andera?
No, Mr. Chair.
Any other comments on the motion of due pass for House Bill 1199 as amended?
Mr. Chair.
Yes.
Thank you, Mr. Chair. Well, I want to echo Representative Schaefbauer's comments that really when the patient is talked about in this scenario, they're the ones that can suffer the most. And I've had this experience even with my father, who has had medical procedures that have been ordered even on a stat level, and they've been waiting for 3 weeks to get authorized through insurance, which when you think about a stat order should be something that is done in the immediate period. So I really want to thank all of the entities involved that you all came together and tried to find a compromise. I really do appreciate that, and it's a good first step for patients to make sure that we're putting them first. Thanks.
Thank you. Further comments on the motion of 1199 as due pass motion of 1199 as amended? Seeing none, what we have before us is once again due pass motion for House Bill 1199 as amended. All those in favor will say aye. All those opposed say nay. Madam Secretary, please call the roll.
Representative Rayfeld.
Aye.
Fosness.
Aye.
Halverson.
Aye.
Jordan.
Aye.
Garcia.
Aye.
Emery.
Aye.
Andera.
Aye.
Kaiser.
Aye.
Schaefbauer.
Aye.
Manhart.
Aye.
Baxter.
Aye.
Heineman.
Aye.
Mulder.
Aye.
13 ayes.
Mr. Chair. Mr. Chair, can we put it on consent?
Okay. Second order of business is House Bill 1220. an act to regulate the retail sale of nicotine products and to provide a penalty thereof. Are there any proponents?
Yes, sir.
Just, yeah, hang on. We'll get to you. Thank you.
Mr. Chair.
Go ahead.
Good morning. Brian Mulder, District 11 out of Sioux Falls. I do have an amendment online, House Bill 1220A. I would like that moved if possible.
Okay. Yes. Representative Rayfield.
I'd like to move 1220A, Mr. Chair.
Okay. Is there a second to that motion?
Second.
Second by Representative Fosnes. The motion is to amend. Let's see, 1220A, which is in front of us. Is there any discussion on that? Nope, not being. Okay, we'll go ahead and vote. That's a voice vote. All those in favor of the motion to amend, say aye. Aye. Those opposed, same sign. Okay, motion carries.
Thank you, Mr. Chair and committee. 1220A is a pivot from what our original bill. South Dakota is one of only, there are 41 other states that have a nicotine retail licensing law on the books. South Dakota is only one of nine that does not have that on the books. We did have more of a retail bill put together, but after some extensive talks with stakeholders on all sides of this bill, we pivoted to move to a wholesale and distributor licensing, and that is what 1220A is for in front of you. So primarily this is a nicotine licensing bill for distributors and wholesalers that we're asking those who supply our retail stores to be on record and get licensed through the Department of Revenue. To get more into the nuts and bolts, I'll step aside and let Ms. Stalley come up and testify to what the bill does for us in the nuts and bolts. But essentially, once again, what we're doing here is asking our nicotine distributors and wholesalers to become licensed through the Board of Revenue so we can get a count of how many of those are serving our state and our retail stores across the state.
Okay, further proponents. House Bill 1220A as amended.
Mr. Chairman, members of the committee, Jennifer Stalley on behalf of the South Dakota Nurses Association this morning, and I would just piggyback on the comments of Representative Mulder. House Bill 1220 started as a conversation about licensing retailers of nicotine products. And I think it's important to understand that right now there is a fairly robust regulation system for tobacco products or traditional tobacco products as folks would think of them, cigarettes, chew. That has been in our code for a long time. What we've seen is the evolution of new ways for nicotine to be delivered, specifically through some alternative methods, which would be pouches, Zyn, if you will, and also through vape. And so early discussions this session were about how to wrap our arms around where those products were being sold and how to build out regulation that would allow for the accountability of that at the retail level. I would say I think those conversations are ongoing, but at this point in the legislative process, we've come to the conclusion that there is maybe some consensus on the wholesale distributor licensing package versus a retailer license. And by that I mean what House Bill 1220A does is it requires all nicotine products, not just cigarettes and chew, but all nicotine products that are being distributed in the state, whoever is distributing them to have a license to do that so we understand where these products are coming from. That currently is in law under 105011, so it's referenced in Section 2. Currently, we require that of anyone who is distributing cigarettes or chew. That's already in law. We're proposing that we would raise that fee from $150 to $1,000 for the distributor license because that fee has not been raised since 1995 at the earliest. If you look back in the code, that's the last time any change was made to that section. So the proposal is to increase the fee for the wholesale or the distributor license of any nicotine product and then apply that specifically to these new products or these new ways, if you will, of how nicotine is being delivered. I think, as you go through, it's a fairly straightforward nuts and bolts of how that happens. It would mimic the exact system that we're using right now for cigarettes. So from the Department of Revenue's perspective, hopefully this is an easy transition for them to be able to add all nicotine product distributors or wholesalers to the law. And then I would point out Section 1, in our effort to kind of continue to have these conversations and get a better sense of where tobacco products, nicotine products are being sold. Section 1 would actually provide the authority for the Department of Revenue to share with the public, who is licensed pursuant to these statutes. There's a statute that limits taxpayer information coming out of the Department of Revenue. We certainly respect that, but that's why you see Section 1 being something that doesn't have to do with this licensure, but instead has to do with giving the Department of Revenue the authority to release all of the people who will be licensed under these statutes so that we know exactly what the universe is that we're discussing as we continue to have what I would anticipate to be further conversations about retail level licensure for all of these products in the future. So with that, I would just say that I think we're bringing everybody up onto the same plane with this as far as licensing the wholesalers and distributors of nicotine products, and we would ask for your support.
Thank you. Further proponent testimony for House Bill 1220A.
Good morning, Mr. Chairman, members of the committee. My name is Dawn Alitsky, and I am the Executive Director and Lobbyist for the South Dakota Petroleum and Propane Marketers Association. I don't really ever appear before this committee, so I'll explain that a little bit. That means I represent gas stations and convenience stores and truck stops. We do sell the products that are being spoken of in this bill, and we do represent both retailers and distributors. Those distributors would be my large grocery distributors like Amcon, Core-Mark, and McLean. And so we, after working with Jen Stolle on this bill, we have all come to consensus, and we would ask for your support, and I'll stand by for any questions. Thank you.
Thank you. Further proponents? About 6 minutes left.
Good morning, Mr. Chairman, members of the committee. Roger Tellinghues, and registered lobbyist for Moyle Petroleum. Moyle Petroleum owns 16 convenience stores in South Dakota. And initially, I was going to get up as an opponent to the bill and want to thank Representative Mulder for the amendment that's been made to the bill. And in light of the amendment, we would encourage your support.
Thank you. Further proponents? Should we go to online? All right. Angela Konecki, are you there?
Yes, I am. Thank you. Thank you,
Go
committee. Everybody can hear me okay?
Yes, they can. Go ahead. Thank you.
Great. Yes, initially I was here. I'm representing Emily's Hope. My name is Angela Konecki. We have a youth substance use prevention coalition where we do a lot of work in this area. And originally I had joined to support licensing the retail establishments that sell these vape products. But I think any steps we can take toward getting a handle on these vape products and what's going out there and where they're being sold is a great first step. I would tell you that we have done our own studies and have found that 5 of these shops are within a quarter of a mile of the schools in Sioux Falls, and 6 are within a quarter of a mile of schools in Rapid City. We are very concerned from our perspective about these products getting into the hands of young people. We know it happens. We have a school resource officer on our coalition who tells us that children as young as 2nd and 3rd grade have been caught with vapes in Sioux Falls public schools. And we know that these flavored products are extremely attractive to children. 80% of middle schoolers who have vaped use these flavored products. And so anything we can do in this state to follow the 41 other states that have licensure and regulations of vape shops is a great first step. And I would encourage you to pass this measure.
Thank you for that. Further proponents for House Bill 1220A as amended? Okay, is that all for online? That's all for online. Okay. Further proponents? Okay, if none, then we'll go for opponents. Opponents of House Bill 1220A as amended.
Good morning, Mr. Chair, members of the House Health and Human Services Committee. My name is Caleb Rose. I'm a small business owner from Rapid City. I own 2 vape shop brick and mortars that specialize in vape products. I was initially coming here today in opposition of 1220. However, as amended, I think I'm going to be asking you guys to pass it without recommendation. And let me get into that further. Let me start by saying something clearly. I support keeping nicotine products out of the hands of minors and kids. I'm a parent, first and foremost. I have a 3-year-old and a 9-year-old that aren't with me today that I absolutely love to death. They are my world. I card, I train my employees, I invest in ID scanners, I support compliance checks and meaningful penalties for retailers who knowingly sell to underage customers. Responsible business owners want bad actors removed from this industry. However, with this recent amendment, I would like to ask, like I said, for a pass without recommendation. Without recommendation, due to the fact that I haven't had quite a chance to talk with all parties about it, I would like some more feedback from my distributors and wholesalers. As a retailer, this is great. It doesn't hurt me at all, right? So why would I even oppose it? However, it will narrow the number of suppliers, risking higher costs. Not a terrible issue. I think there's going to be ways around that, but it's something to be noted. Also, there's no protection for kids here, and I really am looking for something that has kid protections. It seems like framework for a future nicotine tax, that concerns me. Again, the definition is slightly overbroad. I think we'll hear that from other people today. However, I do see what they're trying to do. There is synthetic nicotine coming out. Congress did give the FDA authority over synthetic nicotine, and there's constantly new analogs coming out all the time, and businesses trying to get around things, right? So I see what they are trying to do, and I'd like to work on that definition and meet their goals as well. Another concern I have is this messes with Chapter 10 is what we're amending here, and we've been told over and over again by different authorities and figures here at the state that Chapter 10 has to do with the Master Settlement Agreement. And if you know anything about the Master Settlement Agreement, South Dakota receives a payment from these tobacco companies, and the payments constitute $20 million a year, and we have to be very, very careful what we do with Section 10. That's a lot of money, and I think it does a lot for us as a state. Again, I was registered as an opponent, however, asking for a pass without recommendation, respectfully, because like the previous person said, any steps we can take are going to be great. We need to do something. It's ridiculous that the kids are attracted to these things. I constantly ask my customers, please stop vaping in front of your kids. Yeah, you could do it inside. Yeah, you could do it in your car. That's fine. You can also ghost it. You can also hide it in your hand. You can also go into your bathroom and turn on the fan. Your kids don't have to see this. So for those reasons, I thank you for your time, and please pass this without recommendation.
Okay, further opponent testimony on House Bill 1220 as amended.
Chairman, Jordan Mason here, South Dakota Retailers for Better Alternatives, and please forgive the voice, I'm still getting over a cold. Yeah, thank you again for the opportunity to testify on this. As the previous speaker stated, we were originally in strong opposition, however, have moved to a soft opposition. To get into the details, our main opposition and our concern really is the under the definition of nicotine product. If you compare the various states that have a nicotine product definition, there's Arkansas, Virginia, Alabama. Currently, this definition is without question the broadest. And our real concern is the specific phrase where it says any substance intended to mimic or replicate the pharmacological effect of nicotine. Now, our concern here is that this is going to have a far sweeping effect to include products that this is not intended to regulate. So energy drinks, caffeine, various products that obviously are not vaping products. We do have some concerns there. The other issue is what's known as a dormant commerce clause issue. Whether or not the state of South Dakota, in its current, jurisdictional authority, has the right to affect interstate commerce due to the fact that many of these distributors are from out of state. However, as stated by the previous speaker, those are our two primary concerns. And again, we are looking for youth protections to actually implement that at a state level. But outside of that, we see drastic improvement from the original bill. And again, we are a due pass without recommendation at this time. Thank you.
Thank you. Further opponent testimony for House Bill 1220. And Mr. Mason, you need to sign in as well. Okay. Further opponent testimony. Do we have some online? No? Okay. Further opponent testimony? If there isn't any, then we'll give time for rebuttal.
Mr. Chair. Thank you. I would just echo, obviously, you're hearing that we need to take a step forward, and I don't know if moving it forward without a due pass recommendation is the right step, as this is just step one in the process, and we have time to have some more discussion. But also, when it comes to the definition, I know that we were back and forth on definition a little bit, but again, just trying to take what was originally I believe, and maybe Ms. Sally can correct me if I'm wrong, but what was already there in what we had in statute and where we're at now moving forward with the nicotine products that are available. So this nicotine definition isn't just specific to South Dakota. It's one that other states have as well. So with that, that's what I have for rebuttal. As we heard is, we need to take steps moving forward and to get our arms around this really rapidly growing retail operation. And this is just step one in getting our arms around that, is understanding who are the wholesalers and distributors supplying these retailers and what products do they have. So with that, I would stand by for questions, but urge your due pass of House Bill 1220A.
Okay, thank you for that. Now we'll move into the question section. Are there any questions for anyone?
Mr. Chair.
Yes, Representative Fosmas.
Thank you, Mr. Chair. Question for Jen Stalley.
Go ahead.
Mr. Chairman, Jennifer Stalley.
If you could please clear up on the Title 10 with tobacco settlement and just walk us through from your perspective on any effects that this bill could have on future settlement.
Mr. Chairman, thank you for
Go
that
ahead.
question, Representative Fosnas. So the only reference to to Title 10 is in Section 1 and Section 2. And to be clear, Section 1 is not referring to the tobacco settlement at all. It's not referring to the master settlement agreement. It's referring to a completely different chapter within Title 10 that has to do with what information the Department of Revenue can make public. So that has nothing to do with tobacco, other than we would be adding to that the fact that the licensees under this bill could then be released publicly. We could see who they are, who the licensees are. Under Section 2, the change is not to anything substantive in 1050. It's merely taking the fee that's set right now at $150 and making it $1,000 for that license, to recognize that that fee has not been increased since at least 1995. I don't believe that the current definition impacts the master settlement agreement, but we would certainly be open to input or comment on that throughout the process if we need to double check that, but it's certainly not the intention that it would. Actually, what the bill is doing is creating a completely separate chapter outside of 1050. 1050 is where the master settlement agreement and the tobacco regulations are all held, and they're held inviolate over there for the very reasons that the gentleman mentioned. This is creating a new chapter that would start to regulate nicotine for purposes of sales and licensing and safety. We believe that this is outside of the master settlement agreement.
Thank you. Follow up? No, okay. So Representative Baxter.
Thank you. Question for Ms. Stahli, sorry. So just to follow up, whether it's a retailer of nicotine or vape products, they both pay the $1,000 increase of the fee.
Go ahead.
Mr. Chairman, Representative Baxter, the bill has been changed, so the only people who would be being licensed or paying the fee under this are the distributors. So the folks that are bringing the product to your local retailer. And that, again, mimics exactly what we're doing with cigarettes right now. So the manufacturer makes the product, the distributor brings it to the retailer sells it. We would be licensing the person that's delivering the product to the retailer with this, if it's a nicotine product. Yes.
Okay. Representative Rayfield.
Thank you, Mr. Chair. Can you tell me about how this fee compares with tobacco fees for the same distributors?
Mr. Chairman? So by raising the fee for the tobacco distributors to $1,000, it would be the same fee then throughout for anyone who's selling a nicotine product. So really, we're trying to keep nicotine products at the same fee level throughout the statutes. So a vape distributor would pay the same as a tobacco-only distributor.
Follow-up?
One follow-up.
Go ahead.
Is that also the same for the penalties?
Go ahead.
Mr. Chairman, yes, the new sections from Section 3 on, where we're creating the nicotine distributor licensing, is mimicking the current structure that's in law in 1050 for tobacco distributors.
Okay. Representative Jordan.
Thank you. My question was the same if it was the same as tobacco or not. So I got that answer. Thank you.
Okay, thank you. Okay, Representative Schaefbauer.
For Jen, or Ms. Stahli, please. So with the licensing of these wholesalers and the list, how is putting the list out and licensing these wholesalers going to help protect kids if that's the ultimate goal?
Mr. Chairman. Representative Schaefbauer, I think the way that happens is one, the list is necessary so that our retailers can understand who is licensed. So who's gone through the process with the Department of Revenue to be a licensed distributor. How it helps us with our kids is, it's the first step. It would make sure that we understand where these products are coming from. I think even the gentleman who was a soft opponent, neutral, was indicating that this will help us understand where the products come from, who's delivering them to the store, so that we have some understanding of what the quality of the product might be down the road. So it's definitely the very first step in that process of understanding where these products are being delivered from and then being resold at retailer levels. And I think the retailers would tell you is that they would like to have, or people who sell them, I don't want to speak on behalf of the retailers, people who sell the product, they want to know that the person that's bringing it to them is licensed and has some accountability up the chain. So I think it validates the chain of how the product's coming to the store, Representative.
Follow-up?
I'm not sure. I can't remember his name. Yeah. Caleb? Okay.
Yeah, Caleb Rose. I'm a business owner from Rapid City.
Go ahead.
Oh, thank you, Mr. Chair. So, have you had issues with nicotine products being, I'll just use the word poisoned? The pouches, the nicotine pouches. Have you had issues with the just the quality, or has there been something nefarious with these pouches that they need to fall in line with cigarettes and other tobacco products?
Go ahead.
No, in particular with the nicotine pouches, we haven't. So I think the last nefarious issue we dealt with as a vape industry was when we were convoluted with the marijuana industry and there was a volley epidemic, but the CDC came out and said that was THC cartridges. But beyond that, as far as adulterated nicotine products, in particular pouches, there hasn't been any worries.
Okay. Follow-up? One more.
So how would licensing these distributors help you to make sure these nicotine products and pouches are better quality? I mean, tell me how that would help you when you haven't had an issue with these nicotine products.
Yeah, absolutely. To her point, the previous testimony, it would absolutely add some legitimacy to the distributors. Right now, I've been in. A lot of us vape shops have been in the industry long enough that the distributors we communicate with, we've known them for so long, we can kind of filter through, right? But if those distributors were required to get a license like this, it would help a lot. It's hard not to be too envious of liquor stores and C-stores when they can just call a local distributor, right, and get it done. That being said, I would still worry that if a distributor was prevented from signing up in South Dakota, that other distributors would be inclined to monopolize on that.
Okay. Further questions? Yes, Representative Rayfield.
Thank you, Mr. Chair. It's probably a question for Ms. Stolle.
Thank you.
Mr. Chair, can I have some leeway to give some background to my question?
Yes, go ahead.
Thank you. So, as you know, I'm very interested in taxing vape and nicotine products at some point to make it fair across the spectrum. So the original bill, to my understanding, was making sure that we understood where the vape products are being sold so that they can be appropriately taxed from my perspective. Now it looks like it's more falling in line with the distributors. Would that still enable us, from a standpoint of tracking, to understand where these products are being sold to potentially be able to tax the products?
Yes,
Mr. Chairman, Jennifer Stolle. Representative Rayfield, yes. So if we're making the parallels over to cigarettes, we tax cigarettes at the distributor level. That's where the tax stamps are put on a pack of cigarettes. And then they're distributed down to the retailer who sells the product. So this is, like I said, a first step of figuring out where everybody is in that chain of from manufacturer down to retailer. But this is at the top end of it, figuring out where everyone is and accounting for them, and it would be a possible place where you would be imposing a tax.
Follow up? No? Okay. Yes, Representative Garcia.
Is there any, I'm sorry, not for you, but is there anybody here in the room from Big Tobacco, by any chance that can weigh in? If not, then for the Prime. Okay, sorry. Is there anyone in the tobacco in the back that would come up? Wow, okay, that's a first, learning.
Okay.
Thank you for your presentation there. I have a question. With the terminology, everything seems to be in the terminology of these proposals. So my question to you is, have you discussed this with Big Tobacco, the terminology and the issues with the settlement? They haven't weighed in, so I'm kind of concerned about that.
Okay.
Go ahead.
The tobacco settlement, have had.
Identify yourself first.
Oh, I'm sorry. Brian Mulder, District 11 representative. Well, I don't want to call them out, but the AG's office is in the room, and we did have conversation about the tobacco settlement, and the reason they're not speaking up is because we believe this does not touch the tobacco settlement. We've had original conversations with tobacco all summer long, in different options than what we're proposing. And again, the reason we're in the room, they're not in the room, is because they're silent on this at this point, and because they've been involved in conversation. So does that answer your question?
Not really. I'm just trying to find out why wouldn't they get up there and say yes or no on this? So that's a concern.
Okay.
Yes.
Representative, go ahead.
I'll
Is there a
defer
question?
to representatives, or not representative,
Thank you.
Jennifer Stolle.
Okay. Ms. Stolle, state your name. Go ahead.
Mr. Chairman, Representative Garcia, as Representative Mulder said, we've had a group of stakeholders working on this all summer. I believe that when it comes to different tobacco-related issues, the tobacco lobbyists, the tobacco companies, if you will, don't weigh in on issues that are that they're not opposed to. Also, in deference to, there's a whole bunch of restrictions on what they can and can't weigh in on with regard to tobacco because of the master settlement agreement. So I'm just going to give them deference to make their own decision on whether they come up or not. I can tell you that they've been involved in the discussion and aware of the amendment and understand the steps and the objective that the public health groups have in understanding where nicotine products are being sold and regulating them in a way that is ultimately targeted at young people not having access to them in the same way that we have regulated tobacco. So don't want to speak for them, but I can assure you that they have been part of the process, and I respect that they are not opposing the bill at this point based on those conversations.
Okay, thank you. Further questions? Representative Schaefbauer.
Sally, please.
Mr. Chairman.
So you just said that you and a whole bunch of stakeholders have been working on this since the summer. And when I went through this bill, I must not have scrolled down enough to see the amendment, or the amendment just got published when I was looking at this bill. So why such a big hog house right before committee when, what was the first bill, 12 pages or something like that? Can you help me understand why last minute here's all this read?
Mr. Chairman.
Go ahead.
Representative Schaefbauer, that's an excellent question. I will tell you that, again, from the public health world, in a perfect world, we would be sitting here talking to you about 1220 as it was proposed. But the reality is as we've had conversations both with the Department of Revenue, with the retailers, with the stakeholders, there are just a number of areas in that bill that we're still working through, and we didn't have consensus on those issues for this hearing this morning. What we did find consensus around was the wholesale licensing parallel that we're making with this amendment. So I think you heard from a number of people who said that they were opposed to the bill as it started, but can support this next step. And so, my experience has been that making change at this level takes incremental steps, and this is the first step in moving towards a broader understanding and regulation of nicotine products.
Follow up?
Would you concur with that, with such a large amendment at this
I will
time?
say
Okay,
at 11
identify
o'clock.
yourself,
Oh, yes, sorry. Jordan Mason, South Dakota Retailers for Better Alternatives. And thank you for the question, representatives. Yes, I would say it was a bit of a surprise at 11 p.m. last night to see the amendment. It is a significant one, but overall, it is a dramatic improvement from where we started. To be quite blunt, this took out some of the, what I would say, offensive language in the original bill. I think ourselves and the South Dakota retailers were in agreement that, small mom and pop businesses in South Dakota shouldn't be treated like sex offenders. The first bill did do that. That has been taken out. So we do see some dramatic improvement that it seems like reasonable, sensible regulation.
Any further questions of our committee? Seeing none, let's move into discussion and/or action. Representative Manhart.
I move due pass.
Okay, there's a motion for due pass on House Bill 1220 as amended. Is there a second? Second by Representative Kaiser. Is there discussion on that motion? Anyone else? No discussion? Okay. Seeing no discussion, we'll go ahead and proceed to vote. The motion before you is to do pass on House Bill 1220 as amended. Those that will support that motion will say aye. Those opposed, Secretary will call the roll.
Representatives Rayfelt,
Pass.
Fosness,
Aye.
Halverson,
Aye.
Jordan,
Aye.
Garcia,
Aye.
Emery,
Aye.
Andera,
Aye.
Kaiser,
Aye.
Schaefbauer,
Pass.
Manhart,
No.
Baxter,
Aye.
Rayfelt,
Aye.
Schaefbauer,
No.
Heineman,
Aye.
Mulder.
Aye.
We have 11 ayes, 2 nays.
With a majority vote of the members elect, House Bill 1220 as amended passes. It goes down to the floor.
All right. moving along, we have House Bill 1162. Add certain substances to Schedule 1 of the Controlled Substance Schedule. We'll set proponent testimony and opponent testimony at 12 minutes. Proponent testimony, go ahead, Representative.
Mr. Chair, committee members, my name is Jana Hunt. I'm the representative for District 28A, and I'm bringing before you House Bill 1162. This bill is simply adding tianeptine and phenibut to the Schedule 1 list in the state of South Dakota. Schedule 1 drugs are defined as drugs with currently no accepted medical use and have high potential for abuse and addiction. Both tianeptine and phenibut are highly addictive, and the FDA has not approved them and does not recommend their use. So tianeptine is also known as gas station heroin. It was created in the 1960s in France, and it was studied to be used as an atypical antidepressant, but in the U.S. right now we are selling it over the counter at gas stations for a research chemical dietary supplement to help aid cognitive enhancements. At least 9 U.S. states have taken legislative action to restrict access to this drug and have placed it on the Schedule 1 list. Rapid City is actually the community that has taken the initiative in our state to ban its sales within their city. This happened last year. They've reached out to legislators to see if we can get it on the Schedule 1 for the entire state. Tianeptine acts like an opioid, and it interacts with opioid receptors, and it does have severe withdrawal symptoms that can cause seizures, loss of consciousness, and has resulted in death throughout the United States. Phenibut was developed in Russia in the 1960s, and it too is sold as a research chemical and an unregulated supplement that the FDA has not approved and has advised people not to buy and use as an unregulated supplement. In the decades between 2009 and 2019, there were over 1,320 phenibut exposure calls to the poison control centers in the United States. 80 cases resulted in comas, and major life-threatening effects occurred in 1 to 8 cases, including three deaths directly contributed to phenibut. This is a controlled substance in many European countries, and Utah placed it on the Schedule 1 list in their state last year. There are significant and serious side effects to both of these drugs, but I won't take up more time going through those. I just asked for a do-pass motion to put these 2 drugs on the Schedule 1 list.
Thank you. Further proponent testimony for House Bill 1162. Proponent testimony.
Good morning, Mr. Chair, members of the committee. Jenna Severin, South Dakota Police Chiefs Association. We often see people, seeking to treat their ailments and sometimes mistaking a product as being safe because of its availability, whether that's online or even in person at gas stations or brick and mortar stores. But availability is no indication of effectiveness or safety. In speaking with the police chiefs on this particular matter, Rapid City has already taken steps to ban, and forgive me, I think the prime sponsor certainly pronounced it better than I did, tianeptine, in that area of the state. But as long as it's available in other areas, there's going to be infiltration problems. So we're certainly in support of this legislation, and we would ask for your support as well. Thank you.
Thank you. Further proponent testimony for House Bill 1162. Proponent testimony for House Bill 1162.
Hello, Caleb Rose again, business owner in Rapid City. I have 4 brick and mortars, 2 that I've mentioned before are vape shops, and 2 that I would consider hemp stores, all 4 of which you would all probably call smoke shops or head shops. But I try to avoid the glass and the other things. I constantly turn on the news and hear about new products that these bad actors are selling, gas station heroin, these brick and mortars, and it's so frustrating. And I love seeing laws like this that take these products off the market. When we go to trade shows, you see a few of these products running around, and it is so frustrating. And I can't keep track of them. And so thank you guys for doing the due diligence of keeping track of them, and thank you for this bill. I'm a proponent, and I thank you for your time.
Thank you. Further proponent testimony for House Bill 1162. Proponent testimony. Seeing none in the room and none online, we'll move to opponent testimony for House Bill 1162. Opponent testimony for House Bill 1162. Seeing none in the room or online, we'll skip the need for rebuttal and then move to committee questions. Committee questions. Any committee questions? I guess I have one for the Prime.
Representative Jana Hunt?
Thank you. Just to be clear, there's actually two we're adding?
Yes.
Okay.
Tianeptine and Phenibut.
Yeah, we kind of centered around the tianeptine, but not the phenol, I guess, and what I heard in the testimony. So I just wanted to reiterate that for the committee, that there was two substances being added, not one. Okay. All right. Any other questions? Seeing no more questions, time for, we'll move to committee action and or discussion. Committee
Mr.
action.
Chair.
And Representative Bandera.
I move to pass.
Okay. We have a due pass motion by Representative Bandera, a second by Representative Manhart. Any discussion on that motion? Representative Bandera.
This particular piece of legislation is about safety of our citizens, and I commend the sponsor for bringing it. I think it's needed, and we should all do our part to stay on top of all of this new stuff coming out there. So, thank you.
Thank you. Further comments on the motion? Further comments on the due pass motion of 1162? Seeing no more comments or discussion, what we have before us is a due pass recommendation moved by Representative Bandera, seconded by Representative Manhart. Due pass recommendation for House Bill 1162. All those in favor will say aye. All those opposed will say nay. Madam Secretary, please call the roll.
Representative Rayfelt.
Aye.
Fosnis.
Aye.
Halverson.
Aye.
Jordan.
Aye.
Garcia.
Aye.
Emery.
Aye.
Andera.
Aye.
Kaiser.
Aye.
Schaefbauer.
Aye.
Manhart.
Aye.
Baxter.
Aye.
Heineman.
Aye.
Mulder.
Aye.
13 ayes.
Having received a majority of the committee members elect, House Bill 1162 will move to the floor with a due pass recommendation, and I will certify that for consent. Okay, we are now on House Bill 1240. Yep. I think we're in search of our good representative, potentially from another committee. Representative Goodwin is coming over from another committee, I believe.
Mr. Chair, I just wanted to say I'm glad to see that he's back from his accident. So
Yes.
he's been in everyone's prayers, so I'm glad that he's healing well.
Yes, I echo that, and we'll give him a little extra time to get over here.
Someone's notified him, correct?
I believe that's where Mr. Mason is right now.
Yep.
Good morning.
Good morning. Hold on one second, and we'll officially we'll get started on this bill, if that's okay. But it's very good to see you up and walking around.
Thank you.
Representative. All right, we have House Bill 1240, establish requirements for the distribution and sale of vapor products and provide a penalty therefore. We'll take proponent testimony at 12 minutes, and as we said, it's very good to see you, Representative Goodwin. Go ahead, proponent testimony.
Representative Goodwin, District 30. I'm here to be a proponent for House Bill 1240 committee. My committee introduction speech is as follows. Mr. Chair, members of the committee, thank you for the opportunity to present House Bill 1240. House Bill 1240 establishes clear, enforceable safety standards for nicotine vapor products in South Dakota. It protects kids, increases transparency for consumers, strengthens enforcements, and funds regulation without using any general tax dollars. The bill protects public health. It clearly defines what are regulating and non-combustible nicotine devices and liquids, while explicitly excluding FDA-approved cessations and therapeutic products. We are regulating nicotine vapor products, not medical devices, and not unregulated aerosol techniques. It limits flavor products to age of 21
and over specialty stores that derive at least 25% of the revenue from vapor or tobacco. Convenience stores remain limited to tobacco, mint, and menthol, and that is tightening of the EU access, not an expansion. It establishes product safety standards and ingredients limited to nicotine, vegetable glycine, propylene glycine, if I could pronounce this, food grade flavoring. Products must comply with recognized USP and food chemical codex and contamination tolerances. Department of Health will promulgate the sanitation and manufacturing standards. Consumers need to know what they are inhaling. It strengthens packaging and marketing controls, requiring child resistance packaging, ingredient disclosure, federal warning labels, and prohibiting youth targeting branding and exterior advertising. Bill creates accountability and enforceable standards. Distributors and retailers must be licensed. Retailers must use integrated third-party age verification system at the point of sale. Bill requires 3-year record keeping, provides a good faith defense for compliant retailers. It requires notice and opportunity to cure and authorize civil penalties up to $5,000. House Bill 1240 funds its own enforcement. 80% of the license go to the Vapor Product Regulatory Fund. 20% go to the Tobacco Prevention Fund. This is not an unfunded mandate. Approximately 800 retailers obtain licenses at $250 each. That generates roughly $200,000 annually, covering protected administrative costs. No vapor manufacturers currently operated out of South Dakota. And in closing, the bill also requires an annual legislative report on licensing, enforcing public health outcomes and economic impact. That ensures oversight and data-driven evaluations. Thank you very much.
Thank you, Representative. Further proponent testimony for House Bill 1240. Further proponent testimony for House Bill 1240.
Chairman, thank you. Jordan Mason here with South Dakota Retailers for Better Alternatives. And Mr. Chairman, members of the committee, thank you for the opportunity to testify on this. This is our bill from the industry. We have taken all the considerations from last year and tried to come up with a comprehensive approach to create a regulatory framework around the vaping industry. As our prime adequately relayed to you, this is fairly comprehensive. Goes over not only the definitions of what goes into the product, it goes into the marketing standards, and it also includes some fairly strenuous and strict requirements on who can and cannot sell these products. Part of the reason we know there's some kickback on that, and we're willing to compromise, obviously, with some of the other retailers based on their comments. However, if you look at the FDA and their current compliance checks with electronic nicotine delivery systems, which stands for ENDS, the violations predominantly are not at specialty stores. We've also spoken with the state of Utah and found out that similar regulation actually decreased youth access and incidence, which is why we included in that restriction. As we have stated in the previous testimony, we are actively interested in getting youth access eliminated. I will say I think state of South Dakota has done and made great strides at decreasing that rate. I will say last year I think it was a bit of a misspoken stat when talking about the youth rates. A lot of those stats were actually from 5 to 6 years ago. If you look at current rates, they have decreased precipitously, but we are on board with getting that down to 0. In addition, I would just say that this is a comprehensive regulatory scheme. I think it's a fairly, hopefully not just a first step, but a last step in providing the framework to protect our kids and also to provide an alternative to tobacco use, which is the whole point of the vaping industry, which is to prevent the 1 billion lives lost to tobacco-related illnesses each year. So we would ask for a favorable recommendation and passage on HB 1240. Thank you.
Thank you. Further proponent testimony for House Bill 1240.
Hello,
Caleb Rose again. Thanks for the opportunity to keep practicing this. Mr. Chair, members of the House Health and Human Services Committee. Like I said earlier regarding SB 1220, I strongly support preventing youth access to nicotine products. Again, we card every customer. We train our employees. We invest in compliance systems. And the responsible retailers I associate with do not want minors in our stores. We don't want products in the hands of kids. And this takes a structured and workable approach to that goal. It creates a clear licensing system for retailers, and that matters. If we want to curb youth vaping and eliminate bad actors, retailers need to be held to higher standards. HB 1240 does that without creating unnecessary barriers to entry. The bill requires integrated third-party age verification at the point of sale. That is meaningful, and it's a good safeguard. My employees love it. They just scan the ID. They don't have to worry. They did the right thing. It moves enforcement beyond simple visual ID checks and sets a standard that can be objectively evaluated. 1240 includes a good faith protection for retailers when fraudulent IDs are used and the businesses follow proper verification procedures. That's critical. The retailer should be held accountable for negligence but not punished when they act responsibly and are deceived. 1240 restricts exterior advertising. It bans youth-targeted marketing. It prohibits free samples and limits flavored product sales to adult-only locations, deriving significant revenue from vapor and tobacco products. I've often heard in years past when we're talking about the problem with vape products, all of the banners and the billboards and the shops and the windows that pop up, and I have a problem with that as well. The bill also includes something important from a fairness perspective. Notice and reasonable opportunity to cure before products are designated as contraband. That reflects due process. It allows correction before destruction. The framework of 1240 builds accountability into the supply chain. It sets safety standards. It protects due process. It funds enforcement and tobacco programs, and it does it without imposing catastrophic and flexible penalties. As a retailer, it is hard to support 1240 after seeing the amendment on 1220. A lot of me would love to come in here and say, oh, well, 1220 as a retailer, forget about 1240. But I am interested in protecting the youth. I'm interested in taking care of this now. I'm sick and tired of coming back here. I mean, I love you guys, but this is getting old. So let's do something now. 1240 isn't perfect yet. There's different things that we need to work with. I'm sure that a lot of the ideas we got from Utah aren't going to sit well with some of the parties, and we're willing to work around that. For these reasons, I respectfully ask for your support on 1240 so we can continue working on it and refine and strengthen it. Thank you for your time, and I'm happy to answer any questions.
Thank you. We have got about 3 minutes left on House Bill 1240 proponent testimony. Further proponent testimony. Okay, seeing none, we will, any online? All right, seeing none, we'll move to opponent testimony for House Bill 1240. Opponent testimony.
Mr. Chairman, members of the committee, Jennifer Stalley on behalf of the American Heart Association. I won't belabor the testimony that I gave earlier with regard to 1220. Part of the reason that there was a compromise on 1220 was that the parties have not come to consensus on what a retail licensing structure would look like. It certainly wouldn't include many of the provisions that are proposed to be in 1240. We hope those conversations will continue, but House Bill 1240 has a number of technical issues with it that make it unworkable and would not be one that would be fruitful in continuing any type of conversation about a retail licensing structure in the future. So we would ask that you would oppose House Bill 1240.
Further opponent testimony to House Bill 1240.
Mr. Chairman, members of the committee, Bill Van Camp. I'm a lawyer from Pierre and a registered lobbyist for the South Dakota Retailers Association, and I too am glad to see my friend back in the building. And I understand his intent in this industry and looking at coming to solutions as it relates to these types of products and their sale in the retail environment, but this bill has a number of structural flaws and a number of issues that are concerning to the Retailers Association, and we feel it's largely unworkable. And I'm not going to belabor the point and go through the bill in great detail, but I'm just going to point out a few sections of the bill that really make it, in my opinion, and the Retailers Association, unworkable. Looking at Section 7 of the bill, this seems to be and one of the proponents spoke of the ease of which we could use a integrated point of sale third-party verification system. It seems to me to be a requirement that would be put in law that we buy that a retailer, whether or not they're Casey's General Store with 56 stores or the mom and pop down the street that's only got one store, that they have to buy a specific type of software or a product that is approved by the Department of Revenue. I don't know if the Department of Revenue is in that business, but I couldn't find something similar in the alcohol laws. Now, I should have said this when I started, back up. You know, as you looked at the last bill, 1220 and 1240, we already have in law, if we're selling any sort of a tobacco product, and if nicotine is added to that definition, a requirement that we are at least informing the department that we intend to sell those products, that we buy those products from a licensed distributor or wholesaler, and that we are restricted from selling those products to people who are at least 21 years or older. So that's already in the law as it relates to tobacco-related products. This seems to be Section 7, a requirement that we go out and buy something that is yet to be determined by the department as something that would qualify for that. If you look at Section 8 of the bill, and one of the proponents spoke of this too, this would take certain products that are already on the market, already being sold, and restrict them to certain types of shops only. So that which might be sold now at a general retail store, a service station, or another store that might be a member of ours, now they're going to take certain types of products and move those into vape shops only, and we don't think that that's fair. If it's legal, and that's always been the retailer's position on a number of these types of issues, if it's legal and can be sold, we should be able to sell it complying with what the state law is. 21 and older, fine. But beyond that, we think that this is unduly restrictive and removes certain products and moves them into a certain type of facility only. Section 11 of the bill, this is a very important issue for us. This seems to place a retailer at risk of violating the law and committing a Class 2 misdemeanor for selling something that they have bought from a distributor or a wholesaler. I mean, I have a number of friends that own gas stations and sell these types of products, and I don't know if they know, have educated themselves on Section 11's definitions of what is or is not a product that can be sold. Now, they buy their products from an authorized and licensed wholesaler or retailer, or I'm sorry, wholesaler or distributor who has registered with the Secretary of State's office and the Department of Revenue, but they don't have to get down into the nitty-gritty of what is in the product. They buy it from somebody that's licensed in the state, and they assume they're able to sell it. This would make them a criminal. Section 13, no advertising, no digital media broadcast signage. You couldn't put a placard up for a product that you're selling. We don't think this makes sense to us. Same with Section 14. Any medium. You're going to have a number of bills this year, and some have already died, and there's some that are yet to be heard that have to do with age verification in advertising. Why that's in this bill, I don't know, but it says that a retailer cannot advertise or market on a medium that lacks age restriction access controls. I don't have any idea how a retailer could comply with that other than to just block any kind of a reference whatsoever to those types of products. The bill has a lot of good intentions. Nobody supports these products being sold, advertised, or used by people under 21, but we just think mechanically this bill is not workable, and we would urge your opposition to it. Thank you.
Thank you. Further opponent testimony at House Bill 1240.
Good morning, Mr. Chairman, members of the committee. My name is Dawn Aleitsky. I'm the Executive Director and hired lobbyist for the South Dakota Petroleum and Propane Marketers Association, again representing convenience stores and gas stations. I think Mr. Van Camp did a really good job of overviewing some of the exact same concerns we have. The cash register, that's a swipe device, I believe, on the cash register, but not everybody uses the same software. I also have a problem with Section 8. When I read this, the first number 1 says restricts access to individuals 21 years or older, and I realize it says you may only sell tobacco, mint, or methanol. To me, does that mean nobody can walk into my gas station because I'm selling it? Is that access? What is access to the 21-year-old? Does that mean I have to put them behind the counter like I do cigarettes? That was problematic for me. Clearly, the second portion is about vape stores. And then Section 9, I just want to bring this to your attention, and somebody will correct me if I'm wrong on this, but it says only a retailer or distributor may sell vape products online. That really bothers me that you could sell these online. I understand a distributor might be making an order and then they deliver it with a truck, but when I think about a retailer selling it online, I'm not sure that that's legal for tobacco or alcohol to sell online. So that's just a cautionary one for me. In addition to that, there's promulgation of rules for 2 agencies in this bill, Department of Health and Department of Revenue. To me, that just kind of further confuses the issue. You guys just passed 1220. We did work in conjunction with all the other players on that one. We like that one. We like that that's a first step. We think we should continue on that, starting with the distributors, get down to the retailers, to ensure in the end that these products are only getting into the hands of people 21 or older. Presently, my members, any product they sell that's a vape product or I guess you would call it vape juice or refill, it's 21 only in our stores. So with that, we'd ask you to oppose, and I'll stand by for questions. Thank you.
Thank you. Further opponent testimony for House Bill 1240.
Good morning, Mr. Chair, members of the committee. Doug Schinkel with the Department of Revenue here today in opposition of House Bill 1240. Quite honestly, at this point, we're just basically a Me Too, just 1 or 2 quick points that haven't been mentioned that I'd like to. It was mentioned that this is not an unfunded mandate. That's technically true because there are some monies at the back end to help with some of the things that need to be done. However, there's going to be some programming costs that would be required up front, and there is no upfront money to pay for those. BIT resources are extremely limited. Department of Revenue resources are extremely limited. So if there's any type of programming that's involved with any type of a bill, obviously there's some upfront costs that just aren't paid for here. Again, there's money on the back end, so a point that probably can be handled if it needs to be. Section 22 of the bill talks about, I apologize, give me 1 second. It talks about providing a report regarding the economic impact of vapor products, public health outcomes, all of these sorts of things. The Department of Revenue does not have the expertise to talk about the economic impact of vapor products. It's just something that we just simply, that we don't have the staff or the resources to do. Quite honestly, there's probably some good points to this particular bill. There were some great points to House Bill 1220 as well. I don't think this one is quite ready for prime time. And I think the discussion can still be had to get some of the good points of 1240 maybe into 1220 as that moves forward. It just seems that this bill is just not ready for prime time, and we're kind of a Me Too, and we'd appreciate a no vote on 1240. Thank you.
Thank you. Further opponent testimony to House Bill 1240.
Good morning, Mr. Chair, members of the committee. My name is Beth Docken. I'm a division director with the South Dakota Department of Health. I oversee our Division of Family and Community Health. And certainly we don't want to see vapor products get in the hands of kids, so I do appreciate the intent of the bill, some of the things mentioned in the bill. However, we do have concerns with the bill as written for a number of the reasons that have previously been stated, but really the Department of Health's Tobacco and Prevention Control Program does not have expertise in the regulatory space. We focus on prevention, education. We offer the Quit Line services to help folks quit using tobacco and nicotine products. There currently are no manufacturers of vapor products in South Dakota, and so establishing and promulgating rules to regulate those folks just seems unnecessary at this point and burdensome. As outlined in Section 20 of the bill, the 20% of the licensing fees would be deposited into the Tobacco Prevention and Reduction Trust Fund. It's hard to know at this point how much would actually come to the department, if that would offset the cost of the administrative requirements of the bill. We already do publish stats and survey results on our website each year from different surveys that are given to the public on vape usage in teens, adults, middle school. So that is already available. As was previously mentioned, having two different departments promulgate rules is confusing. That would be more costly. So for these reasons, we would ask you to also oppose this bill. Thank you.
Thank you. Further opponent testimony? The timer did just go off at our 12-minute mark, but further opponent testimony? Seeing none in the room or online for Me Too's, we'll move to a rebuttal. About 5 minutes for that. Thanks.
Chair, thank you. I definitely appreciate some of the concerns that were brought forward. As I had originally stated, and again, Jordan Mason with South Dakota Retailers for Better Alternatives doing the rebuttal at the permission and request of Representative Goodwin. As I stated when going over this bill on Section 8, that is intentional. If you look at, again, the reporting violations, we have found that repeatedly there does need to be some sort of workable solution. And again, this bill was brought in response to the concerns raised by this very committee and the legislator last year regarding the vaping industry. We heard you. We came back with hopefully a workable solution. In response to some of the comments, and I saw some emails or whatnot that came from the agencies, I would just point out that at our current $250 per location licensing fee, the $200,000 cited by the Department of Health would be covered at 800 shops within the first 800 shops that were licensed under this bill. That would cover $200,000 pretty clearly. That's pretty simple math. The duplicative annually reporting statement that was made as well, I do not find that to be true. Currently under Chapter 3446, it specifically lists tobacco-related reports that are currently made. And that does actually include in various factors that include health impacts and costs that is reported to the legislator related to tobacco. This would extend that to include it for vapor products. Again, the overall intent of this legislation is to actually having meaningful restrictions and a regulatory framework to protect children while also helping adults get off tobacco. Like it or not, and I'll just say this publicly, vaping has been the number one method worldwide to help people quit smoking. Governments all around the world have spent billions of dollars. It is, without question, the number one preventable death in our day and age. And the reality is the free market enterprise came up with the best solution. And so that is why I'm here trying to advance regulatory framework to preserve something that will preserve the lives of people that are addicted to tobacco while also keeping it out of the hands of youth. I think we do need to work on striking a right balance, and I would ask for your favorable recommendation and vote on HB 1240.
Thank you. Committee questions. We'll move to committee questions for HB 1240. Yes, Representative Halverson.
This is probably for Jordan Mason.
Go ahead and state your question, and then you can raise it.
Okay, my question is this. You heard all of the opposition, and yet I think that this is probably a good basic bill. Are these questions from the opposition, is this something that we could fix yet this year? Or is this something that we maybe need to put on a back burner and try to take care of those issues, because there is some broadness to this.
Go ahead.
Chair, thank you. Yes, as stated, we're more than open to refining and open to amendment to refine this to make it a workable solution. So absolutely, we're willing to work with any stakeholders or partners to make it work.
Any other questions? Let's go ahead and state your name real quick.
Oh, Jordan Mason, South Dakota Retailers for Better Alternatives. Sorry.
No problem. Yes, Representative Bandera.
Thank you. I believe this would also be for Mr. Mason. I am reading here that the vapor in Section 11, a vapor product sold for resale or retail in this state may not contain any ingredients other than A, B, C, D. This may seem like a really, really stupid question, but I would presume that any vape products containing THC would not be allowed under this bill. Is that correct?
Right. Our Chair, Jordan Mason, South Dakota Retailers for Better Alternatives, thank you for the question. One of the main reasons that we wanted to bring legislation, and I've said this to a number of you before, we are frankly sick and tired of being lumped in with something that our product was never intended to be used for. This was originally actually designed by a Chinese pharmacist in the early 2000s after his dad died from cancer due to tobacco-related effects. So we are not, our product is not to be used for drugs and narcotics. It is to be used to quit smoking. So yes, again, and I appreciate the question. And those are the 4 primary ingredients which you can find in your household today.
Thank you very much.
Thank you.
Further questions for House Bill 1240? Further questions? Yep, Representative Shapar.
For the Department of Revenue. So can you, because I'm confused between 1220 and 1240 and your opposition to this one and no opposition to the prior one. Can you explain that to me?
Sure. Mr. Chair, Doug Schenkel, Department of Revenue. I don't think the department is opposed to some sort of regulation, and in fact, we probably believe that there's some need for regulation of this particular industry. I think what we're looking at here with 1220 was, and palms up, we would have been in opposition to 1220 in its original form. And in fact had signed up as an opponent in 1220 in its original form. As it was amended, we then chose not to get to the mic on that particular bill. I think what we're looking at here is a situation that at this particular time, this 1240 bill is not ready for prime time. There's some operational errors, some issues with it in getting it, number one, implemented by July 1st, and not having the money to, if I need to create a retail license, that's going to cost programming time and dollars. In fact, I don't have a specific amount, so I couldn't tell you right now. I'd have to work with my bit friends on that. But there's no money in my budget to pay for that right now. So we would need to figure out a method of creating that license. It would be next to impossible to have this bill implemented by July 1st. So from my standpoint, there's just some operational errors. And then again, as we're looking through the bill, I believe it was mentioned, don't remember who mentioned it, but in section 7 of the bill, for example, that talks about integrated point of sale system approved by the department. We can't have that. Absolutely cannot have that, because that creates liability issues for the department. If we say, yeah, this is a perfect solution here for you to have this particular integrated point of sale system, and then it fails for some reason, there's liability issues. The department cannot and will not be able to do that. So there's some things here that are just aren't ready for prime time. That said, I think there's some good things in 1220. I think there's some good things in 1240, and I really think that it's at the you'd be at the point now where, since 1220 is kind of moving through the system, to get those two groups together and have that discussion on that particular bill, figure out what works for everyone there, and move forward with one bill that people can be happy with. And I guess that's why we opposed this particular bill and not the 1220 bill, because that was amended. The 1220 bill was amended down to something that's easily administrable at this particular point. Gives all of the parties involved an opportunity to sit down and talk about the issues, and maybe create some sort of a resolution there. And I guess that's why we opposed this particular bill and not the other one at this point.
So you have the budget to create the license for distributors, but not for wholesale or for wholesalers, distributors, but you don't have the budget to create a license for small businesses. Is that what you're telling me?
Mr. Chair, Doug Schinkel again. And no, we would need some money there too, but that thing's moving through the system, so we would have the conversation there as well. The fact of the matter is that any type of a new license is required, or any type of new tax is required for us to collect, those sorts of things, we have some upfront costs. And we would have to have that discussion as well.
So 1220 and 1240 could work really well together, but you would have to include the small businesses as one of the stakeholders, which until the amendment came on 1220, they weren't included in the stakeholders. Is that the way I'm understanding all this?
Mr. Chair, you know, I don't know if I can really answer that question properly for you. I think there have been discussions since the beginning of what the proper method is, and to actually regulate these particular products. I just saw the amendment for 1220 actually this morning before I came to committee. So I'm struggling to answer that particular question, because I know there have been conversations, I know there have been meetings, I know the stakeholders have been involved. I just don't think that there's been any kind of a consensus as to what is the proper method to move forward right now. And I think there's still more discussions that need to be had. And I think there's probably issues with 1220. I think there's probably issues with 1240, and I may be speaking a bit out of turn, and I apologize for that if I am. I think that we would struggle to, or we's wrong word. I think you would struggle to get something passed that is workable and that is okay with all parties involved. If you've got competing horses out here, for lack of a better term, it makes sense to me to get the parties involved talking about one particular topic and making sure that what you're doing it right, and making sure that it's not creating some unintended consequences. And I'm concerned that right now 1240 does that a little bit, and it's possible that 1220 does that a little bit too. But it seems to me that at this point, if it would make sense to I guess ride the one horse and get things in the right fashion for all parties. And again, not just the department here. I think there's far more at stake than the Department of Revenue here.
Yes, Representative Fosnes.
Thank you, Mr. Chair. I'm not sure who my question really would be pointed to. I don't know that it's necessarily Department of Revenue. We've, in 1220, we talked about wholesalers. In 1240 now, we're talking about retailers, but not licensure. So my question is, what's the obstacles with a bill that would be truly about licensure for the retailers selling this, instead of just distribution and sale of it with a penalty thereafter? And so I'm not sure if that's, maybe Ms. Stalley from Heart Association could answer that. Thank you.
Mr. Chairman, Jennifer Stalley, American Heart Association. Representative Fosnes, I think maybe to go to your question and then to go to Representative Schaefbauer's question earlier. So 1220 and 1240 came in as bills, so if we think of them in their original form, and we have had numerous conversations with all of the stakeholders, with Mr. Mason, with the convenience stores, with tobacco companies, with the vape representatives, and we've come to, at this point in session, a bit of an impasse. One is on what level of enforcement there would be. 1220 in its original form had more enforcement for a violation. Two, what the fee would have to be for a retail license. It's at $1,000 in 1220's original form. It's at $250, I believe, in this. And we've heard from Department of Revenue that might not, it has to be somewhere in between there for them to have enough money. And then there is this overarching conversation about what vape products should be sold. So we could get into a very long presentation on the FDA has authorized certain vape products to be sold. They've gone through a process and the FDA has said these products are authorized by us. There are other products that are in the queue waiting to be authorized. There are other vape products that have not availed themselves of that. The flavored products tend to be either in the waiting or in the not availed. So those are the issues that are substantially at debate amongst all of the groups that are talking about retail licensure. I would respectfully submit that I think those conversations are going to continue to take place, but this is not the correct form for them to move forward. I think we're getting closer, but if we move 1240 forward, I don't think those conversations will continue with all of the parties, because in particular, 1240 protects the sale of flavored vapes. And so we've heard a lot of conversation from the proponents of this bill about how they don't want children to start using vapes. From the public health perspective, banana cherry is what gets a kid to smoke vape, the flavor, okay? And so we're trying to have productive offline conversations about how do we come to some middle ground on that, move forward with licensing retailers, not get into the debate about FDA authorized, non-authorized because of that federal mix-up. I think if 1240 goes forward, it will be very hard for me to continue to convene those groups. And for those of you who were here last year, you'll remember you had House Bill 1069. And at the end of the day, it became a fight between the FDA authorized and the non-authorized. The public health groups, under the leadership of, frankly, some legislators on your committee, have been trying to bring those groups together to have conversations about how to make steps forward. The amendment to House Bill 1220 took us one step farther. House Bill 1240 will set back those conversations, and that's why we think that those obstacles need to be taken offline, not move forward in this bill right now, because it will actually stunt the ability to continue those conversations about retail licensing. I appreciate the intent, but I don't think it's in the spirit of the group that's been meeting.
Further questions? Representative Baxter.
Question for Caleb Rose. I just want to get a follow-up opinion from your side of what Ms. Stolle just had brought up, and just flavoring with the vapes.
Oh, certainly, Mr. Chair.
Name first.
Oh, Caleb Rose, Black Hills Vapors in Rapid City, Mr. Chair. Representative Baxter, so in how our industry is, whether or not 1240 preserves flavors moving forward, or what was your?
I was just looking for follow-up for what she was talking about in regards to the flavors are very attractive to the kids.
Mm-hmm.
And just wanted to hear your take on.
Oh, certainly. Yeah, without a doubt. I suppose when I was in high school trying cigarettes for the first time, if there was a bubblegum flavored cigarette, I might have been more inclined to try it, but I was looking to get twisted. And when I look at the sales of my flavors at my store, I think 1 to 5% of my flavors are menthol and tobacco based, and 90 to 95% are flavors. Whenever I hear the testimonies from my customers when they come into the store and they're baffled that they were able to quit cigarettes, it's not because of a tobacco flavor. They're excited about a strawberry cheesecake, or they're excited about a blueberry muffin. And whenever one customer is talking to another, trying to convince them to leave their pack of cigarettes at the store and leave with a vapor, what they tend to center on is the flavors. That's what they get excited about. That's what works. So I think that one of the reasons that it's so much more effective than anything else at quitting smoking is because of the flavors. That's why the industry constantly pushes to preserve those.
Representative Schaefbauer.
is your industry one of the stakeholders at the table with the opposition who's trying to make the industry better?
Yeah, I feel like we've all been, we've had a decent position at the table, and we've all been talking with each other. The amended version of 1220 we didn't have anything to do with, but it's surprisingly friendly to us, and hopefully we'd continue to be able to have discussions on 1220 as amended.
Okay, further questions? Seeing none, we'll move to action and/or discussion. Representative Heineman.
I move to send 1240 to the 41st day.
We have a motion to send House Bill 1240 to the 41st day by Representative Heineman, seconded by Representative Halverson. Comments on that motion, Representative Heineman.
Thank you. Well, I do appreciate your exploring this particular issue. It's quite clear that this is going to contradict really what we're trying to accomplish with 1220. I think it would be appropriate to go back to the table after we get 1220 through, and try and get everybody, stakeholders, to the table and get this worked out, because it's a long road. It's really a long road. There's a lot of things that need to be addressed. You just touched on a few things: vaping products, the flavored products, quitting smoking. I mean, we talked about a bunch of different things, and while I appreciate your efforts, I really do think that we need to start with the 1220 and then move into the other areas. So thank you for that.
Further comments, Representative Halverson.
Yeah, I'm like the previous speaker. I believe that there's a lot of valid information in 1240. My fear is that it's not ready. There are too many discrepancies in it, but it is a good piece of legislation down the road. And if we were to pass this right now, I'm afraid that the seats would all go empty, and it would not continue to go forward. So that's why I'm liking the 41st day.
Representative Schaefer.
Thank you, Mr. Chair. I'm going to oppose this motion for a few reasons. One, if this bill is giving adults the option to get off of cigarettes, tobacco products with vape flavors, I mean, who are we to tell them that they can't have a vape flavor, which I honestly think is kind of ridiculous. Second is, this looks like the small businesses, this industry wants to work with all the larger stakeholders, the Department of Revenue, the health, any of the other people that are in opposition to this bill. And third, it kind of frustrates me that the prior bill had such a big amendment on it at such a late hour. We really didn't even get to read it. And now it's like, why can't they work together? The industry is asking for these regulations. They're not opposing them, and just trying to help small businesses stay in business and asking for the regulations on themselves, I think puts a good faith effort forward. So I'm going to oppose the 41st motion.
Mr. Chair.
Yes,
Make a substitute motion do pass.
And we have a substitute motion of due pass for House Bill 1240. Is there a second? Second by Representative Schaefer. Comments on that motion, Representative Jordan.
Thank you. I'll just second everything Representative Schaefer just said. This is the industry that has been, people have been trying to ban them for years, and they're saying, hey, we want to reach a compromise, and this is a compromise. So I think we should, at a minimum, respect that they want to compromise and help regulate the bad actors in their own field. And also, I also second if people want to have a weird flavor or a different flavor, why do I care? So please pass.
Further comments on the substitute motion, Representative Schaefer.
One more comment. I want to state loud and clear. I am not for children to have these products. But as adults, I'm okay with that. And if it helps somebody to quit smoking, fine. If it's somebody's relaxation, that's not a hard drug, fine. And I appreciate the industry saying, you know what, there's some problems with with the boom of all these products flooding the market at once, and we want to be at the table with everybody, and we want to be regulated. So, I commend them. Is the bill perfect? I don't know. Was the other bill perfect? I don't know. But I appreciate the willingness that the industry wants these regulations on themselves, which a lot of industries don't want.
Further comments on House Bill 1240? Representative Indira.
Thank you, Mr. Chair. I am going to support the do pass motion, and the reason why is because I think we have to get ahead of this before we wait for something to happen. It's already starting to happen, in our towns. People are finding ways to put different types of substances into these vapes. There are several parents that I've talked to that are very, very concerned about this, and I'll reiterate what Representative Schaefbauer says. Is it a perfect bill? Maybe not. Maybe it can get amended. Maybe we can work in between the time now and the time that it gets to the floor. But I think it's time. So I think we're past time. It's time to do something. Thank you.
Further comments on the do pass motion of House Bill 1240? I'll make one final comment before we take a vote. I'm going to ask you to resist the do pass motion on House Bill 1240. We've been kind of talking freely about 1220 and 1240. I do know this, on both these bills, we did have stakeholders around the table trying to merge them together. 1220 had we had several drafts on House Bill 1220 that took elements of 1240 and put it in there. But at the end of the day, we still did not have consensus from the stakeholders moving forward. And what frustrates me about 1240 is we didn't have the same conversation about 1240. Those same stakeholders that were involved in 1220 didn't have the comprehensive conversation of 1240 or even amending 1240. So now it's coming forward in its original form by one entity, not all the stakeholders. As far as the comment about 1220, and there was a meeting last week that took place for over an hour after session. And, at the end of the day, the reason 1220 took form is because that's kind of where everyone said, okay, we can look at wholesalers and distributors and what that looked like. And so that's why 1220, knowing that all these complications in both 1220 and 1240 were not going to be acceptable, that's why 1220 came forward. 1240 has all the same issues that 1220 had in its original form that wasn't acceptable to people. And now we heard 1240 is not acceptable either, except for one group who didn't amend it from its original form in all those conversations. So this is all that to say, this is a very complicated topic. Obviously, these conversations have been happening for months, and we still haven't come to a consensus on what is best for South Dakota to move forward, including the department, retailers. And when we talk about retailers, we have to understand this is also retailers of our name brand convenience stores that are across the state, not just what you would call potentially vape shops, smoke shops, or independent stores that are getting set up where this bill has come from. So with that, as we mentioned, this is a complicated topic. 1240 ignores a lot of the concerns that a lot of stakeholders had, and it's, as we heard, it's just not workable moving forward. So I'd ask that you would resist the do pass motion. At least I'm going to do that. And with that, we will move forward with House Bill 1240. We have a do pass motion by Representative Jordan, seconded by Representative Schaefbauer. All those in favor will say aye. All those opposed will say nay. Madam Secretary, please call the roll.
Representative Rehfeld.
Yes.
Fosnes.
No.
Halverson.
No.
Jordan.
Aye.
Garcia.
Aye.
Emery.
No.
Andera.
Aye.
Kaiser.
No.
Schaefbauer.
Aye.
Manhart,
Aye.
Baxter,
Aye.
Rayfelt,
No.
Heineman,
No.
Mulder.
No.
6 ayes, 8 nays, or 7 nays.
Yep.
Having failed to receive the majority vote of the elect of the committee, the do pass motion of House Bill 1240 has failed. We are now back to the original motion of 41st day for House Bill 1240. Further comments, Representative Heineman?
No.
All right. Further comments. With that, Madam Secretary, we now have a motion of House Bill 1240 to be deferred to the 41st day. All those in favor of that motion will say aye. All those opposed will say nay. Madam Secretary, please call the roll.
Representative Rayfelt.
No.
Fosness.
Aye.
Halverson.
Aye.
Jordan.
No.
Garcia.
No.
Emery.
Yes.
Andira.
No.
Kaiser.
Aye.
Schaefbauer.
No.
Manhart.
No.
Baxter.
No.
Heineman.
Aye.
Mulder.
Aye.
6 ayes, 7 nays.
Having failed to receive the majority elect of the committee, the do pass motion of House Bill 1240 fails. The motion to refer to the 41st day of House Bill 1240 fails. Representative Rayfelt.
I move to the floor with no recommendation.
All right, we have a motion of House Bill 1240 to move to the floor with no recommendation. Comments made by Representative Rayfeld, seconded by Representative Baxter. Comments on that motion? No comments on that motion. All right, we have a recommendation or a motion to move House Bill 1240 with no recommendation to the floor. All those in favor of that motion will say aye. All those opposed will say nay. Madam Secretary, please call the roll.
Representatives Rayfelt.
Aye.
Fosness.
No.
Halverson.
Aye.
Jordan.
Aye.
Garcia.
Aye.
Emery.
No.
Andera.
Aye.
Kaiser.
Aye.
Schaefbauer.
Aye.
Manhart.
Aye.
Baxter. Heineman.
Nay.
Mulder.
No.
9 ayes, 4 nays.
All right. House Bill 12, having received the majority of elect, the motion of House Bill 1240 going to the floor with no recommendation has passed. Okay, here's where we find ourselves. We have one more bill. It is House Bill 1211, create a digital registry identification card for medical cannabis patients. We have technically 15 minutes. We could stretch it to 20 minutes. The chair has done his homework along with LRC and some other committee members, and we all know that none of you have a committee after this. And we know that the room next to us is open and has been scheduled for House Health and Human Services to convene at 10 o'clock. So what we'll do is we will start our proponent testimony for House Bill 1211. And we will run proponent and we'll get into opponent testimony as far as we can. I will ask us to go in recess at about 10:02 to allow us to switch over, and we'll clock in at 10 o'clock or reconvene at 10 o'clock and 4:13 to finish up our committee work this morning.
Mr. Chair,
Yes.
with all due respect, I have local government.
Oh, I thought that was, I don't think there's committee today. Yep, that's what we thought. There is no committee today. So, all right, we will start with 12 minutes of proponent testimony. Representative Garcia.
Mr. Chair, good morning, committee, Mr. Chair, those present and online. I have great news. We won't need all that time. So today, House Bill 1211 was to be heard on creating a digital registry identification card for medicinal marijuana. However, I will be tabling this bill. But before I do that, I'd like to read from the Department of Health, because I think this is an excellent example of collaboration. And what we're here to do as legislators is work together. So if it's okay, I would like to read the letter that the Secretary of Department of Health has sent me. And it is honorable members of the South Dakota House of Representatives. The South Dakota Department of Health is committed to improving accessibility and security within the medical cannabis program. To enhance convenience for patients and caregivers, the department is pursuing the implementation of digital medical cannabis cards. As a part of this initiative, the department posted a request for proposal on January 16th, 2026 to obtain a comprehensive software system capable of creating and managing digital cards. This system will streamline the application and renewal process, reduce administration burdens, significantly reduce wait time for patients to receive their card, and provide a secure, user-friendly experience for program participants. The RFP, request for proposal, includes requirements that prospective vendors must have the capability to create and manage digital cards, as well as the ability to create and manage a card verification system for law enforcement. The department's digital card implementation timeline is as follows. Following the legal procurement process, the department will select a vendor in the summer of 2026. Building and customization of selected software system will begin in early fall, and full implementation of the new system will occur once completed. Upon implementation, the department will provide digital medical cannabis cards to all qualified patients and designated caregivers. While the digital card will become the standard, the department will retain the option to print a physical card upon request. The Department of Health thanks Representative Garcia, thank you, for her work on the Medical Marijuana Oversight Committee, as well as for her continued support and collaboration in advancing the medical cannabis program. That is cordially Secretary Melissa Magstad. So I would like to just thank you for your time in that. This we worked hard on in the summer, and it's great to see that it works out this way, because this is a win-win for everybody involved. So thank you, Mr. Chair. I should say Representative Garcia, District 5, sorry.
Yes, Representative Rayfeld.
Mr. Chair, at the sponsor's request, I move to table.
We have a motion to table House Bill 1211 by Representative Rayfeld, the second by Representative Manhart. That's a non-debatable motion. Madam Secretary will call the roll.
Representative Rayfeld.
Aye.
Fosnes.
Aye.
Halverson.
Aye.
Jordan.
Aye.
Garcia.
Aye.
Emery.
Aye.
Andera.
Aye.
Kaiser.
Aye.
Schaefbauer.
Aye.
Manhart.
Aye.
Baxter. Heineman.
Aye.
Mulder.
Aye.
13 ayes.
Having received the majority of members-elect, House Bill 1211 will be tabled. I will take a motion to adjourn. Representative Manhart made that motion to adjourn, seconded by Representative Baxter. All those in favor will say aye. Aye. Opposed, say nay. House Health is adjourned.
From children's programs to in-depth documentaries, SDPB sparks curiosity and lifelong learning in every South Dakotan. SDPB, good, useful, and full of wonder. SDPB brings South Dakotans together, telling the stories that unite small towns, big ideas, and the people who make our state shine. Good, useful, and full of wonder. SDPB. SDPB shares the voices and experiences of South Dakotans, preserving our stories, our culture, and our sense of place. SDPB, good, useful, and full of wonder. As South Dakota's public media network, SDPB serves everyone with transparency, integrity, and commitment to open access. Good, useful, and full of wonder. SDPB. SDPB helps shape South Dakota's future by educating, informing, and inspiring the next generation of thinkers, leaders, and creators. SDPB. Good, useful, and full of wonder. SDPB serves South Dakota through an interconnected communication system that is on 24/7, 365. The first place for Amber Alerts, public safety announcements, and EAS messages. SDPB keeps public servants and citizens informed. Good, useful, and full of wonder. SDPB. SDPB brings you closer to your government. With gavel-to-gavel coverage of the South Dakota Legislature and in-depth reporting from Pierre. Good, useful, and full of wonder. SDPB. From early learners to lifelong students, SDPB inspires curiosity through trusted educational programs and resources for every stage of life. Good, useful, and full of wonder. SDPB. When South Dakotans need reliable information, SDPB is there providing updates and coverage that keep our communities safe and connected. Good, useful, and full of wonder. SDPB. SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB, good, useful, and full of wonder. From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts programming. Good, useful, and full of wonder. SDPB.
Good morning and welcome to Senate Commerce and Energy. I would ask everyone to please take a seat and have your phones turned to silent. If you plan on testifying today, please sign in at sdlegislature.gov. Press the people icon or link next to the agenda and fill out the form, or you can do this directly on your phone by scanning the QR code on the agenda above the podium. Thank you to those that are joining us online as well. At this time, I'd ask the secretary to please call the roll.
Senators Malhoff.
Here.
Dibert. Excused. Hone. Excused. Carr. Excused. Colbeck.
Here.
Larson.
Here.
Perry.
Here.
Peterson.
Here.
Crabtree.
Here.
Mr. Chair, we have a quorum.
Thank you. At this time, the chair would entertain a motion to approve the minutes of our last meeting. Moved by Melhoff, seconded by Peterson. All those in favor say aye. Aye. Those opposed say no. Minutes are approved. A reminder to testifiers to sign in, and lobbyists, please make sure you're wearing your badges. Any testifiers that have handouts that they want to give to the committee, make sure the pages are distributing those for you. And so at this time, I'd ask the page to come up. Looks like the senator's ready to go, but we're going to ask the page to come up, introduce yourself, and we're in second week, so tell us your best joke.
Hi, everybody. I am Tommy White from Sully Buttes High School. Well, I wrote it down so I wouldn't forget it. Why did the bike fall down? Because it was two-wheeled. Or no, sorry, I was too tired. Sorry.
Well, you eventually nailed it. All right. Thank you. Thank you. Thanks for playing along with us today. A reminder as we work through the calendar today that all testimony and questions are to be addressed through the chair. And at this time, we've got a full agenda here for a little bit, but we've got a couple things that we're going to move around. I think just for those that are here, Senate Bill 226. Senate Bill 226 will be heard on Thursday at the request of the prime sponsor. So if you're waiting for 226, you're free to go elsewhere. At this time, we're going to start with Senate Bill 209, an act to authorize the creation of land banks. Go ahead, Senator Smith.
Thank you, Mr. Chair, members of the committee. My name is Jamie Smith, State Senator from District 15. I'm here today to bring you Senate Bill 209, which is exactly what it says, authorizing the creation of land banks in the state of South Dakota. Can they see the slides that I have here? Thank you. At its core, Senate Bill 209 gives our cities and counties a practical, local controlled tool to address one of the most persistent challenges facing our communities: vacant, abandoned, and underutilized property. The bill allows local governments to establish nonprofit land bank entities that can acquire, manage, and return these properties to productive use. It provides clear governance standards, ensures public accountability, and explicitly protects property rights by prohibiting the use of eminent domain. Participation is entirely optional, meaning communities can decide for themselves whether or not this tool would make sense for them. While land banks are often discussed in terms of blight removal, their relevance in South Dakota goes well beyond that. The legislation is fundamentally about housing, economic opportunity, and responsible development policy. Housing affordability has become one of the most pressing issues across our state. In community conversations held throughout South Dakota, local leaders consistently identify housing shortages as a primary barrier to growth. Employers cannot recruit workers if those workers have nowhere to live. Young families cannot settle in towns if there aren't starter homes available. Seniors cannot downsize if there are no appropriate alternatives. Increasingly, we are seeing housing supplies that directly affect economic development and long-term stability. In many towns, especially smaller ones, the private market alone cannot produce enough housing to meet demand. Development costs are high, and lots may be tied up in tax delinquency or unclear ownership. Structures may be too deteriorated for traditional financing. In some cases, a single blighted property can stall investment across an entire block. Land banks offer a way to break that cycle. By acquiring stalled or blighted properties and clearing legal or structural barriers, a land bank can prepare sites for redevelopment. It can hold property strategically until there is a viable plan in place. It can prioritize the disposition of land for workforce or affordable housing. In short, it can create the conditions for housing development to become possible again. That does not replace the private market. It supports it. It fills in gaps where the market alone has struggled without aimlessly throwing money at the problem. I would also like to address how land banks fit into our broader economic development toolkit, particularly in relation to tax increment financing, or TIFs. Now, TIFs have long been used in South Dakota to incentivize development by capturing future increases in property tax revenue to pay for current improvements. And in some cases, they are appropriate and very effective. However, TIFs are typically tied to specific shovel-ready projects with identifiable developers and projected value growth. They are often used for larger commercial or mixed-use developments where the numbers already pencil out after some assistance from a TIF. Land banks serve a very different and in many cases a more complementary role. Instead of financing a specific development after a project is proposed, a land bank focuses on the groundwork. It addresses fragmented ownership, tax delinquency, environmental issues, and blight before a developer ever steps forward. In that sense, land banks can be seen as an upstream alternative to relying solely on TIFs. Rather than committing future tax increments to make a project feasible, a land bank can lower the upfront barriers so the project becomes feasible without the same level of ongoing public subsidy. In a smaller or rural community where projected tax increments may be too modest to support a traditional TIF district, a land bank may be a more effective tool. It allows communities to intervene strategically without obligating future property tax growth. It can also help ensure that when redevelopment does occur, the full tax base is quickly restored, benefiting schools, counties, and other local taxing entities. This tool is especially important for rural community development. Small towns across South Dakota face unique housing challenges. Many have aging housing stock. Some properties have sat vacant for years because no single owner has the capacity or incentive to rehabilitate them. And in other cases, scattered lots and unclear titles make coordinated development nearly impossible. These communities are working hard to remain vibrant places where families can live, work, and raise children, but they need the tools to build that future. Rural leaders repeatedly say that housing is the key constraint of their future. Without housing, they cannot attract teachers, nurses, small business owners, and skilled tradespeople. Without housing, their schools and Main Street struggle to remain strong. Senate Bill 209 provides a flexible framework that rural communities can adapt to their needs. A land bank can assemble parcels for new homes, clear unsafe structures that depress neighboring property values, and partner with nonprofit or private developers to bring new housing online. Importantly, this bill respects local control. No community is required to establish a land bank, but for those who see the need, Senate Bill 209 gives them the power under state law. In closing, Senate Bill 209 is about more than property management. It is about strengthening neighborhoods, expanding housing opportunities, and supporting rural vitality, and adding responsible new options to our economic development toolbox. It equips local government with a transparent, flexible tool to address challenges that limit growth and opportunity in our state. For those reasons, I respectfully ask you to give Senate Bill 209 a do-pass recommendation. Thanks for your time, and I'll be happy to answer any questions.
Thank you. We'll take further proponent testimony on Senate Bill 209. Any further proponent testimony? Seeing none, we'll close proponent testimony and move on to opponent testimony. We'll take opponent testimony on Senate Bill 209. Welcome, Mr. Howdy-Shell.
Good morning, Mr. Chair, members of the Senate Commerce Committee. My name is Mike Howdy-Shell. I'm the Cabinet Secretary of the Department of Revenue. We do rise in opposition of Senate Bill 209 this morning. Certainly, the goals of the good senator from Minnehaha County are worthy. And I can't really dispute much of that. I do have some concerns about this legislation, though, from essentially a necessity standpoint. I think some of what these contemplated land banks can do is redundant, and there's already tools available in state law to be able to accomplish a lot of the things that Senate Bill 209 seeks to accomplish. Kind of just quickly, just looking at a couple other areas of the bill that I have questions about. But first off, what does it do? Well, it allows local governments, any political subdivisions, to create a land bank, which would be comprised of an unelected board of individuals who would have a lot of powers. And if you look at Section 4 of the bill, there's a whole laundry list of things that a land bank could do. For instance, they could employ staff, they could borrow money, they could issue bonds, they could engage in construction and rehabilitation projects on real property, they could receive money, they could acquire, lease, and sell real property, amongst other things that they could do under the bill. Section 8 is especially concerning, I guess, from my perspective, because it's I think, overly broad. Essentially, it exempts land banks from all taxation, as far as I can tell by my read of it. if you look at it, it's just one sentence. It says the real property of a land bank and the land bank's income and operations are exempt from all taxation by the state and any political subdivision of the state. So not only would land banks not pay any real property taxes on any property that they acquired, my reading of that is they would likely not owe sales tax on any of the goods or services that they purchase to engage in their operations as well. Kind of to contrast that with another tool that we already have, industrial development corporations, which many of you may be familiar with. Those entities are subject to sales tax. They also pay real property taxes. They do have an exemption up to the first $2.5 million of real property that they acquire and own, but they are taxed on anything above that. So Section 8 is kind of a concern from our perspective. And then just a couple of questions I guess I have about the bill. You know, most actions of political subdivisions, whether it's the county commission, city council, the school board, are referable if the voters don't like what's going on. I don't really see anything in this that would allow the public to refer any action of a land bank if they disagreed with it. Maybe they could, I guess, under the general provisions in state law regarding initiative and referendum, but I don't see anything specifically that talks about that. And then I guess I just have questions about how the debt would be serviced. As I mentioned, they could issue bonds, they could take out loans, but there's no taxing authority that would be held by the land bank, so they couldn't levy property taxes. So I'm assuming that it would just be through either loans or grants that the land bank would receive from private entities or from political subdivisions, but there's really no income generating component of it besides, I suppose, the rehabilitation and sale of the real property that they would acquire. And what if they were to go into default? I'm not quite sure what the remedy would be there. So I do, again, applaud the good senator for bringing this idea forward. I don't think that it's necessarily something that's ready for our state. I think there's a lot of questions that I have about how it would work mechanically, and for that I would just ask that you oppose the bill. Thank you.
We'll take further opponent testimony to Senate Bill 209. Any further opponent testimony? Seeing none, we'll close opponent testimony and open it up to Senator Smith to provide sponsor rebuttal.
Well, thank you, Mr. Chair, and I appreciate Mr. Howdy-Shell coming forward with his questions and concerns. The whole point of a land bank is to get land back on the tax rolls and make money. And I have a sheet there on your desk. I'd like you to draw your attention to Omaha Land Bank, where they started out on that graph. Starts really slowly, but I want you to see the return on the investment that has been made by getting land cleaned up and back on the tax rolls. And you can see how that line it starts to go straight up. All right, now once we put that land back into the thing, we then can spread tax responsibilities across another party or many more parties, and it helps your communities. These numbers are round numbers, but they've invested about $9 million in Omaha Land Bank, for example, and I think $90 million return in 10 years. So it's a tool that I learned about when I visited at a meeting down in Omaha, and I think it's a tool that would be good to work on here in the state of South Dakota. And if there are things that we can work on together to get it exactly right, there's nobody wanting to use this right now. That's why I'm bringing it right now, because we oftentimes bring laws when there's a very, very specific reason that we're bringing the law, because we have a very large corporation breathing down our neck that needs something done, and they need it done now. I'd like to work with the state right now to set these up, to get them to the place that we can think that this is a good tool in our toolbox to help. Right now, there's a really exciting announcement that was made yesterday in Sioux Falls. Really exciting announcement that was made And there's an example of a piece of land that is going to need to be cleaned up. Okay, a land bank could own that and do that work, and then the developers could move in and work on that after it was all cleaned up.
Thank you. We'll now move on to committee questions. Are there any committee questions on Senate Bill 209? Any committee questions? Senator Larson, sorry, I couldn't see you there.
Thank you, Mr. Chair. Just learning about these land bank models, can you tell me a little bit more about the costs? You've mentioned that it wouldn't cost the state anything to set this mechanism up. Can you say a little bit more about maybe the experience in Nebraska and how do we know that this won't cost money to administer?
Well, there's going to be
Go ahead, Senator.
Thank you, Mr. Chair. Thank you for the question. There will be cost to administer something like this through that nonprofit organization that needs to be set up and structured. And everything, though, that gets done with these is done at the local level, not with the state level. So the local area will determine how they want to run their land bank. They're run very differently in different areas for the different purposes. The state could also establish a land bank in a regional area, though. If you look at the last section of this, if there's a disaster or something like that, I look at what happened down at McCook Lakes, for example, is an area that is going to definitely need some redevelopment and those types of things. There's going to be title problems on land with floodplain issues and all kinds of things. That would be another area that perhaps something like this could be used. The state would step in, but the local entity is going to figure that out.
Further committee questions on Senate Bill 209? Any further committee questions?
Mr. Chair.
Senator Perry.
For the prime, a few questions, if that's all right.
Go ahead, Senator. Yep.
I know about federal land bank. Tell me the difference between a federal land bank and what you're proposing.
Go ahead, Senator Smith.
Thank you, Mr. Chair. And I am not aware of a federal land bank. I'm aware of these smaller regional land banks and smaller municipality land banks.
Go ahead, Senator Perry, you got a follow-up?
I do. With the landowner property rights, one of the things that we looked at when I looked at the map here is nothing in Utah, Idaho, Montana, North Dakota, South Dakota. Right. If this is a good idea, how come we don't have anything in any of those states that are in our surrounding area?
Go ahead, Senator Smith.
If you look at the adaptation of these types of tools, it moves from areas of probably denser population to, if you look at that, there's less population base. But I would say that it could be a tool that would be very well utilized in different ways in extremely rural areas. You just need a larger regional land bank in order to set it up. It's probably a lot of those areas on that map, if you see their municipal land banks too. Sometimes in cities, one of the tools that was used, land banks were used after the mortgage meltdown to come in and clean up land with really, really dirty title. That's one of the things when you have experts that work at a land bank, that's what they know how to do is clean up title and have the tools available to do that. As you know, attorneys are involved in that process. They can be very expensive. Individuals can't afford to do that on their own necessarily, and a land bank can do that.
Further committee questions? Go ahead, Senator Perry.
One final follow-up, and that is with the way that this is set up, would it be better, when you look at a TIF versus land bank, what is the advantage of changing from TIF to land bank?
Go ahead, Senator Smith.
I don't think you need to necessarily change from a TIF to a land bank. A land bank does the front end. It gets the land ready to go. Cleans it up. We know who the owner of the land is. We now have a parcel of property that is ready to be developed. Once that's done, anything could go on that.
Further committee questions on Senate Bill 209. Senator Colbeck.
Sure. Senator, so been involved in a couple of these already. We've had some houses, Sioux Falls Development Foundation and others. Why would we deviate from the current plan to another? So like using an Economic Development Professionals Association or some sort of private-public partnership, why would you think that this would gain us traction?
Senator Smith.
Thank you, Mr. Chair. I think they can work in tandem with one another. The Economic Development Group has other things that they're worried about. the land bank is purely worried about land and getting it, like I said, getting dirty land cleaned up. If you find a blighted property on a block, for example, they could be in the area of the land bank. They can deal with that. They can deal with an entire block rezoning. They can also hold that land to gather all the parcels necessary to do a project that the development corporation wants to do, and they can be a tool in that and work together.
Further committee questions on Senate Bill 209? Senator
yeah.
Melhoff.
Senator, where would the land bank get their revenue to acquire land, to clean it up, to hold it?
Senator Smith.
Well, they could do that in multiple ways through donation. They can do that through. I mean, there's nothing to say they couldn't apply for state money if they wanted to down the line to fund that. They can also, throughout their municipality, couldn't fund it how they see fit. They can also do whatever they want within their tax structure to support that. But that local level would decide those things.
Further committee questions on Senate Bill 209? Senator Perry.
I'd do one more quick one, and this is again for the sponsor of the bill. We talk about blighted, and can you explain blighted? Because there's probably different degrees of blightedness. When would this kick in, and what degree would you be looking at?
Go ahead, Senator Smith.
Thank you, Mr. Chair. So I think that the community would determine what that is. I think of when it was explained to me, there can be one blighted house in a block, let's say, can take the property values for everybody around it down. And let's say somebody died, 4 different kids inherited it, but there's a whole list of liens against the property and nobody's doing anything about it. And it just sits there. And it sits there and it sits there and it gets worse and it gets worse and it gets worse. At a certain point, a land bank could step in from the community, and they have to purchase it from those people, but they'll come in and make a deal with whoever owns that, saying, we're going to do this, and we're going to take all that risk, okay? Because there's no traditional financing method for that piece of property to come in and do that. So in Omaha, another example is there are people in neighborhoods that are like captains in their areas that keep an eye out for keeping their community looking nice. And when these houses become abandoned and do that to their community, they don't like that because it also brings crime and all those other things. And so they will bring it to the attention then of the land bank that, hey, there's this house on this block over here. Would you guys look into that and see if it's something you could help us with? And if they can, they do.
Further committee questions? We'll close questions and move on to committee discussion. Is there any committee discussion and or action on Senate Bill 209? Senator Perry.
I'd do a quick action, or not action, but a quick comment, and that is when we deal with this and we use the word eminent domain, that always makes me nervous because we've had a lot of discussions on that particular subject, and that would be my nerve center.
We closed questions. We're on to committee discussions. Appreciate you sticking around, but committee discussion.
Mr. Chair.
Senator Melhoff.
Yeah, I would move to table this bill.
We have a motion from Senator Melhoff to table the bill. Do we have a second? Second. We have a second from Senator Kolbeck. A motion to table is non-debatable. So the motion was made by Senator Melhoff, seconded by Senator Kolbeck. Would the secretary please call the roll?
Senators Melhoff.
Aye.
Dibert, excused. Hone, excused. Carr, excused. Kolbeck.
Aye.
Larson.
No.
Perry.
Aye.
Peterson. Crabtree.
Aye.
Mr. Chair, we have 5 yeas, 1 nay, and 3 excused.
After receiving a majority of the votes, Senate Bill 209 is hereby tabled. All right, moving on. We have Senate Bill 170, an act to require the provision of a notice to consumers interacting with certain chatbots or other human simulating computer technologies that could mislead or deceive the consumer. Senator Larson.
Good morning, Mr. Chair, Committee. Liz Larson, District 10. I'm asking for a motion to withdraw this bill, or table this bill, actually.
Thank you, Senator Larson. I know the senator tried to work through the electronic process to withdraw this bill and is asking the committee to move for a tabling motion. That tabling motion was made by Senator Perry and seconded by Senator Peterson. Non-debatable motion. At this time, we'd go ahead and ask the secretary to please call the roll.
Senators Milhoff,
Aye.
Dybert, excused. Hone, excused. Carr, excused. Kobeck.
Aye.
Larson.
Aye.
Perry.
Aye.
Peterson. Crabtree.
Aye.
Mr. Chair, we have 6 yeas and 3 excused.
Receiving a majority number of votes, Senate Bill 170 is hereby deemed tabled. As I mentioned before, Senate Bill 226 will be heard on Thursday, so if you're here for 226, come back and see us on Thursday morning. We are now moving on to House Bill 1035, an act to modify provisions related to the licensure of public accountants. We will take proponent testimony at this time. We'll take either Senator Shanefish or Representative Wisegram, whoever wants to join us. Welcome, Representative.
Good morning. Thank you, Mr. Chair, and good morning to the Senate, House, and Commerce Energy Committee. Today, I'm proud to bring you HB 1035 that establishes an additional pathway to obtain a CPA license while fully preserving existing options. This legislation allows a person seeking a CPA licensure to have their real-world accounting work experience count by lessening the amount of formal education needed to qualify to sit for the CPA examination. Let me be clear. This legislation does not change the existing qualifications to be able to sit for the test, nor does it change the integrity of the uniform CPA examination. Sections 6 through 10 of the bill improve wording of existing code to clarify, update, and streamline practice privileges by allowing CPAs in good standing to practice across state lines, benefiting South Dakota consumers who are increasing the demand for professional accounting services. I'll step aside to allow others to testify to this needed legislation. Thank you.
Thank you. We'll take further proponent testimony on House Bill 1035. Senator Shanefish.
Thank you. Good morning, Mr. Chair, members of the committee. Kyle Shanefish, Senator for District 19. Just want to, as a practicing CPA, give my full endorsement to this bill. I had to go through the grind of passing, not one, but 4 required tests to obtain my CPA license. And I'm very fortunate at the firm I work for that we, have a lot of interns over the summer, and sometimes they'll come multiple years to work for us. And I think providing, students like that another pathway to obtain that license it's going to be really valuable. You can attest that we're very short on having the CPAs and accountants needed to be able to fill the demand out there. I'm sure many of you see me and probably wish there were 5 more of me walking around, but we can't do that. So I think this is a great way to help our workforce in the accounting industry. Thank you.
We'll take further proponent testimony on House Bill 1035. We've got your slides.
All right, Mr. Chair, thank you. Committee members, I'm Tommy Palama, a registered lobbyist and the executive director of the South Dakota CPA Society, and also a certified public accountant. So the Society is a membership organization with over 800 members and certificate holders in the state, both in public practice as well as other areas such as business, government, and education. And we represent close to 70% of the active certified public accountants in South Dakota. Thank you. I'm here today to present on House Bill 1035, which addresses critical challenges the CPA profession is facing. A declining workforce. There are fewer accounting graduates and enrollments have also dropped. There's also an impending wave of retirements in public practice due to our aging population, since a large portion of our current CPA population is made up of baby boomers who are reaching retirement age. Pipeline challenges. This is also a challenge based on the cost and timing of education for students. And then lastly, increasing demand for CPA services. And this is due to more complex regulations, business growth and support, the rise in financial fraud, and the need for advisory services. So encouraging candidates to pursue the CPA licensure is a vital step in resolving these issues while also modernizing outdated requirements. House Bill 1035 creates an additional pathway to obtain a CPA license while preserving the existing options. Candidates will be able to seek licensure after earning a bachelor's degree and completing 2 years of relevant experience. Current licensure pathways in South Dakota will also remain the same. Candidates earn a bachelor's degree and an additional 30 hours of education that do not have to be accounting related. Candidates can also earn a master's degree and also have 1 year of relevant experience. But no matter which of these three pathways is chosen, all candidates must still pass the uniform CPA exam. More than 25 states have already introduced or enacted changes to allow alternative pathways, and this bill supports national trends while also reflecting our state's needs. South Dakota needs to align quickly to ensure that minimal disruption to the profession. House Bill 1035 also streamlines practice privileges by letting CPAs in good standing practice across state lines under one single license. That flexibility benefits South Dakota businesses and consumers relying on CPAs. House Bill 1035 eliminates barriers such as financial hurdles and time constraints, creating flexibility for students, and it keeps South Dakota competitive with surrounding states while aligning with the national movement. This bill also helps sustain South Dakota's workforce as well as supports businesses looking for CPAs. Lastly, House Bill 1035 maintains rigorous licensure standards to ensure consumer protection while modernizing the workforce. This bill recently passed out of the House Committee 13-0, followed by the House floor vote of 67-0. So in conclusion, the South Dakota CPA Society and its members would ask for your support of House Bill 1035. Thank you for your time, and I will stand by for questions.
Thank you. We'll take further proponent testimony on House Bill 1035. Any further proponent testimony? We do have one online. Nicole Casson, can you hear us?
I can.
All right, perfect. We've got you here in the room. Go ahead.
All right. Thank you, Mr. Chair. Good morning, members of the committee. Nicole Casson, Executive Director for the South Dakota Board of Accountancy, and we are here to support House Bill 1035. The Board of Accountancy is responsible for administering and enforcing the laws related to certified public accountants and certified public accounting firms. Our role is to protect the citizens of South Dakota from inadequate accounting services. We achieve this by licensing qualified accountant applicants, monitoring annual reporting requirements, and continuing professional education. And we enforce the statutes and regulations that govern the practice of public accountancy. The proposal in House Bill 1035 aligns with the national trend that does create another pathway for individuals to sit for the CPA exam and to obtain CPA licensure. The bill expands the opportunity for an individual to become a CPA in South Dakota. This is a national movement, as you've heard, where over 25 states have adopted these provisions, including our neighboring states of Iowa, Minnesota, and Montana. It is anticipated that more states will have similar language introduced during their 2026 legislative session. I ask for your favorable support of House Bill 1035, and I will stand by for any questions.
Thank you. Any further proponent testimony on House Bill 1035? Seeing none, we'll close proponent testimony, move on to opponent testimony. Is there any opponent testimony to House Bill 1035? Last call for opponent testimony. Seeing none, we're going to waive sponsor rebuttal and open it up for committee questions on House Bill 1035. Are there any committee questions on House Bill 1035? Seeing none, we'll close questions, move on to discussion and or action on House Bill 1035. Senator Peterson.
Thank you, Mr. Chair. I move to pass.
We have a do pass motion from Senator Peterson, a second from Senator Larson's comments on the motion. Senator Peterson.
I think we heard good proponent testimony, no opponents. I think it makes sense in a lot of ways. Thanks.
Senator Larson.
Agreed. Nothing more to add to that. I think it's a great idea.
We have a do pass motion that was made by Senator Peterson, a second from Senator Larson. Would the secretary please call the roll?
Senators Melhoff,
Aye.
Dybert, excused. Hone,
Aye.
Carr, excused. Colbeck,
Aye.
Larson,
Aye.
Perry,
Aye.
Peterson, Crabtree.
Aye.
Mr. Chair, we have 7 yeas and 2 excused.
Receiving a majority of votes, House Bill 1035 is hereby deemed passed, and unless there are any objections, we are going to place that on the consent calendar. Saying none. All right. Next up, House Bill 1201, an act to authorize the use of bingo games, lotteries, and pull tab devices by booster clubs. We will take proponent testimony at this time. Welcome, Senator Vilhauer. Here I was thinking you were here for the accountant bill.
Nope,
Here-
nope.
Here,
I'm
here for the next one up.
I'm retired, remember?
All right.
Good morning, Mr. Chair, members of the committee. My name is Glenn Vilhauer. I'm Senator from District 5, Watertown. I'm here today to support and ask for your consideration for Senate Bill or House Bill 1201. Before I jump into it, I'd like to acknowledge that 1201 was a lot of help received from the Department of Revenue, along with working with my colleague over in the House, Representative Matt Roby. So I'll reserve the right to phone a friend if something comes up that I can't answer. 1201 really does 2 different things. One is it has to do with bingo games, lotteries, and pull tab devices by booster clubs, and the key word there is booster. If you look at the first section of the bill, the language that we've got out there right now in statute, as far as who can have games of chance, bingo, lottery as defined under certain code sections, the term booster club is not used. This adds the term booster club. Booster club, there's hundreds of them out there. You name it, baseball, any sorts of athletics. You've got Boy Scouts, Cub Scouts selling, popcorn, cookies, whatever. Anyway, but booster was never included as part of the legislation. So that is step number 1, is adding the term booster into what is currently out there as far as bingo, lotteries, and pull tab devices. Now, the second and probably the more important part of the proposed bill is found in section 2. There was an Attorney General's opinion rendered back in 2004 by Attorney General at that time, Larry Long, that seemed to indicate that the booster clubs, or the groups that were allowed to use pull tab machines, had to actually own the facility or own the property in which they were located. And over the years, that has caused confusions, concern, and as a result, what this legislation attempts to do is clarify that no, the entity does not have to own the real estate that the machine is allowed in. So that's a big change that now allows these booster clubs to have these machines in a location not owned by them, because most of these clubs don't own the facility that these machines would be located in. And there are some parameters on that. One is it's got to be a place that sells alcohol. So, for example, you wouldn't see these popping up in fast food places. You name it, would not be popping up in those sorts of entities. And also, they would be limited to each organization would be limited to one per location, with a maximum of two establishments that they could have a machine in. So it seems to be a common sense piece of legislation that actually codifies things that are already being done out there in practice. So to me, it makes sense to look at passing this. I do want to clarify one thing, because in listening to the committee testimony in the House, as well as the House floor discussion itself, there was some concern expressed. If you look at Section 1, it makes reference to political action committees or a political committee on behalf of any candidate. Well, no, that's already in statute as far as the types of entities that can utilize these gaming devices or these games. Section 2, if you'll look at Section 2, is limiting that to fraternal or charitable organizations, local civic service or booster clubs, as I referenced, volunteer fire departments, congressionally chartered veterans organizations, but there is no mention to political candidates, action committees, et cetera, being able to utilize these machines in an establishment that I'm referencing here. So with that, I ask for your support, and we'll stand by for questions. Thank you.
Thank you. We'll take further pro-opponent testimony on House Bill 1201. Any further pro-opponent testimony? Welcome, sir.
Good morning, committee members. I represent Veterans of Foreign Wars Post 2755 in Redfield. We do have a machine. We don't have a building anymore. So
Sir, if you would, just tell the committee your name and then
I'm
go
sorry.
right into your testimony there.
Perry Schmidt, Redfield.
Thanks, Perry.
And being we don't have a building, a bar, or anything anymore, this is our sole means of gathering funds so we can support the veterans organizations that we support, hospitals, and the schools and scholarships, Boys State, and all that stuff that our veterans organizations sponsor. Baseball, everything. So that's pretty much it.
Thank you. I appreciate your testimony and joining us here today.
Thank you.
We'll take further proponent testimony on House Bill 1201. Good morning.
Good morning, Mr. Chair and committee members. I'm Bob Gard from Canton, South Dakota. I am the president of the Canton Wrestling Club. I'm kind of the guy that started this whole bill, thanks to my city attorney and best friend not allowing me to place a machine in my local bar.
Not sure that's helping you. Just go ahead.
I hope not. So I'm asking for your support in this bill in regards to allowing third-party locations and booster clubs to operate pull-tab machines. My booster club is a 501c3 nonprofit organization. Fundraising is getting hard for every organization out there, from fire departments to VFWs to booster clubs. When I first started researching a steady income source for our charity, pull tabs kept coming to the top. Talking to other organizations across South Dakota and in other states, this is a great opportunity for a multitude of organizations to raise funds without overtaxing its members. There's a lot of confusion at the state level on the legality of pull tabs in third-party businesses, and this change clears that up. In speaking with potential bar owners to place a machine, they're excited to have another social game added to their location that will potentially keep their patrons longer. That's all I have. I'll stand by for questions. Thank you.
Thank you. We'll take any further proponent testimony on House Bill 1201.
Morning, Mr. Chair, members of the committee. My name is Sam Nelson. I'm testifying on behalf of myself and want to echo the comments about that awful city attorney that Mr. Guard had mentioned previously. That was me. I want to give you a little bit of background on this bill and why it's in front of you from my perspective. To his credit, Mr. Guard is zealous in his advocacy for Canton Wrestling, and as you know, Canton Wrestling's program is pretty successful. Longtime head coach Jeremy Ask was a coach of mine, and his wife is my law partner. I'm very proud of the organization. But when Mr. Guard was looking at placing one of these in Canton, he talked to people at the state, a bunch of different places, and I found an Attorney General's opinion 04-03 that is from 2004. And what it said was that as the current law was written, they didn't believe that you could put one of these pull-tab devices in third-party locations. And so I told Mr. Guard that, and he asked me, well, what do we do? And I said, well, we're going to have to get the law changed. And so a lot of work went into working with the prime sponsors, Senator Vilhauer and Representative Roby, talked with Revenue to address their concerns. And I can say that I agree with Mr. Guard. There is some confusion about when and how and where these are allowed. And as a city attorney, it's difficult for me because you don't want to tell folks no, but you've got an Attorney General's opinion out there. And I think that the times have changed to the point where, as the gentleman from Redfield testified, we're in a position where the folks that we originally allowed this for can't necessarily have them if they don't have their own building. And so to Senator Vilhauer's points, I think there's appropriate safeguards here for you can put them in bars, places people have to be 21. The charitable organization features ensure that these are limited in scope to who use them, and so I'd ask for your support of the bill, and I'll do my best to answer any questions you have about how it came about. Thank you.
Thank you. Any further proponent testimony? Any further proponent testimony on House Bill 1201? Seeing none, I know we have a written testimony from Jamin Harberts that's been submitted to the committee as well. Just for the record, any opponent testimony for House Bill 1201?
Good morning, Mr. Chair, members of the committee. Matt Krogman, representing the South Dakota Licensed Beverage Dealers and Gaming Association. Our association is made up of bar and restaurant owners throughout the state. I've been fortunate to learn a lot from my dad in this business. One thing I've learned from him is never testify against the VFW, never testify against the American Legion, and certainly don't testify against youth athletic organizations. That's not what I'm here to do this morning. Our concern, and just so you know, I was president of the Brookings Baseball Association for multiple years. I know how hard it is to fund these programs and fund the fraternal organizations. Our concerns comes more with maybe some of the unintended consequences that might come from these. For example, they're put into, let's just say, a restaurant, and there's no regulation on these. So let's say a customer feels harmed, they were cheated or something by the system. Who are they going to go to for their complaint? They're going to go to our employees, and they're going to have to deal with that. They don't have the Department of Revenue because they aren't regulated. Our business is going to get blamed for that. Malfunctioning of machines as they get older. Cash getting jammed in the insert things. Those are things that our association has some concern on. Again, we're not here against these organizations. We just have some concerns with how it's being implemented, and would politely ask your resistance of 1201. Thank you.
Thank you. Any further opponent testimony to House Bill 1201? Any further opponent testimony? Seeing none, we'll close opponent testimony and offer up sponsor rebuttal. Senator Vilhauer.
Thanks again, Mr. Chair, members of the committee, Glenn Billhauer, Senator, District 5, Watertown. I guess my only, or just a couple of responses to that. It's my understanding that if there is any issues with the operations of the machines itself, that will be the responsibility of the organization that owns these machines. And secondly, I guess if there's any concerns on the part of a bar or restaurant, whatever, about what this might, how this might impact their clientele, very simply, they're not required to have them. It's totally optional on their part. And to me, the feedback that I've gotten on this is that by and large, these establishments are encouraging and look forward to having more of these available. So my final comment is that this just clarifies some things that are out there in the statute already, and just gives more fundraising option to some very worthwhile organizations. Thank you.
Thank you. We'll close that and move on to committee questions. Any committee questions on House Bill 1201, Senator Colbeck?
Senator Vilhauer. So we do have a letter up here, and I thought I better pay a little bit of attention to it, but it had a question of how many devices. So inside a device, are we talking, hypothetically, if I was to go to my VFW and they have a machine here, are we talking, like, my VFW has like 6 different games in one machine? Are these the machines we're talking about, or is this a different type?
Well, it's my understanding, and if I'm incorrect, maybe I can get some clarification, that you'd have the one, let's say that multiple organizations want to co-op and use one machine. I believe that would be acceptable, but you're still limited to the one machine, though. One or two? Oh, I'm sorry, 2.
2 machines.
No, it is one. Two for the organization, 1 for the establishment.
Okay. Thank you for that clarification. And then all of that, is there a policy that needs to be written, or is there anything that they're going to follow, just as an document of understanding where the revenues go, where they're collected, and how things are paid?
I think in the legislation itself, it does say that the establishment itself cannot benefit from the machine being there. I think beyond that, as far as how the revenue would be divided or handled, and if there's anything that would concern the establishment itself, I think there could be agreements put in place, but I don't believe this legislation would actually address that, though.
Go ahead, Senator Colbeck.
Just so we're clear, this has no effect on anything that exists today, any of the pull tabs or anything like that?
That is correct.
Okay.
Oh, I'm sorry.
Senator Perry.
I think I'll go with Sam.
Go ahead with your question, Senator Perry.
Mr. Chair, Sam Nelson from Canton, representing myself.
Mr. Chair, simply a question on gambling. Is this going to increase the number of people that are gambling in our state?
Mr. Chair.
Go ahead, Mr. Nelson.
Boy, that's a tough question in one sense, Senator Perry, because I suppose in theory it could, but when I look at where I see video lottery, I go buy gas to come up here, I see video lottery, I walk into establishments in Canton, I see video lottery, I walk into the gas station, I see scratch-off tickets, and so for me personally, there's kind of a tiered level of gambling. I think that video lottery, I think that casinos and those things are more serious. Again, speaking for myself, I think pull tabs are almost a lower level than a scratch-off ticket. I see them in places in Minnesota, and it's I went to the AC/DC concert with my brother and some folks, and you could just buy them out of a bucket at this establishment we were at, and it was like $1 or $2, and you play the pull tabs while you're sitting around eating peanuts. So I don't think this is at the same level of gambling as a casino or video lottery in terms of the societal risk that we would have. To the extent there would be risk, I'd say that's part of the reason we determined that we wanted to keep it in these establishments where you're kind of old, you have to be old enough to be in there anyway. And so I think there are appropriate safeguards in place.
So, Mr.
Further committee questions?
You said yes?
Mr. Nelson, go ahead.
Yes, but not in any meaningful way or number, Senator Perry. I don't think we're going to have lines out the door of the wheel in Canton tomorrow, but I could be wrong, and I'm sure Mr. Gard hopes we will.
Any further committee questions on House Bill 1201? Any further committee questions? Senator Hall.
Thank you, Mr. Chair. Not sure who this would be for, but I guess Mr. Krogman. I'm wondering first if you were involved in the discussions of this legislation, and second, if you would like to give a rebuttal to the rebuttal remarks.
Well, let's go with the question.
Yep, sounds good. Thank you for the question, Senator. Matt Krogman, South Dakota Licensed Beverage Dealers and Gaming Association. I was not involved in the drafting of this. Both the sponsors have been very responsive to our concerns, which I appreciate, but I was not involved in the drafting at all.
Further committee questions? Any further committee questions on House Bill 1201? Saying none, we're going to move on to committee discussion and or action on House Bill 1201. Any committee discussion and or action? Senator Kolbeck.
I'd move do pass on Senate Bill 1201.
Second.
We have a do pass motion made by Senator Kolbeck, a second by Senator Larson. Comments on the motion, Senator Kolbeck.
Yeah, I spent 6 years with 8 years actually on the Booster Club, and we fought for revenue, so I understand that part of it, but I also spend a lot of time in my local VFW, and they have pull tabs already. They don't get much action, but I don't see them as a lotto machine, and I don't view them as a gambling tool like that. So much different game, much different, there's not the lights, the sounds, any of that type of stuff, so I'm comfortable with the bill.
Any further committee discussion on the do pass motion?
Mr. Chair.
Senator Peterson.
Thank you. I'll be resisting the motion, even though it might seem small. I do view this as an expansion of gambling. I don't like the fact that the state is addicted to gambling revenue, and I don't think it's a good example for our youth to be raising money from gambling. I think there are plenty of other sources. And I also object to codifying practice. I think we need to codify something first and then allow it in practice. I don't really feel like that's in the right order just to codify something just because it's already being done. So the other thing is it's raising money in alcohol establishments, and I don't think that's probably a good example for our youth. So I will be resisting the motion. Thank you.
Any further comments on the do pass motion in front of you? Any comments? Seeing none, we had a do pass motion made by Senator Kolbeck, a second by Senator Larson. Would the Secretary please call the roll?
Senators Melhoff.
Aye.
Dybert.
Aye.
Hone.
No.
Carr excused. Kolbeck.
Aye.
Larson.
Aye.
Perry. Excused. Peterson.
No.
Crabtree.
Aye.
Mr. Chair, we have 5 yeas, 2 noes, and 2 excused.
Thank you. After receiving a majority number of votes, House Bill 1201 is hereby deemed passed. All right. That takes us on to our last piece of work in front of us today. The chair has talked to, I think, each member individually about bringing back Senate Bill 6. We've got a discussion where we've found the possibility of using some federal funds for here in South Dakota, and we need to get that discussion going during the middle of the session. So at this time, I would ask for a motion to bring back Senate Bill 6.
So moved.
We have a motion by Senator Peterson, a second by Senator Kolbeck. Comments on the motion to bring that back, Senator Peterson.
Thank you, Mr. Chair. Well, I do think this is an issue that's come up quickly, and it bears discussion. And I think, we'll probably see an amendment to this bill. And then my understanding is it'll be on the agenda at our next meeting. So we'll have time in between to look at that and give the public time to take a look at it.
That is correct. Thank you, Senator Peterson. That is correct. The amendment will be posted shortly after we adjourn today. So we need a... All right. So we have a motion to recall Senate Bill 6 made by Peterson and a second from Senator Kolbeck. Would the Secretary please call the roll?
Senators Melhoff.
No.
Dybert.
Aye.
Hone.
Aye.
Carr excused. Kolbeck.
Yes.
Larson.
Aye.
Perry, excused. Peterson. Crabtree.
Aye.
Mr. Chair, we have 6 yeas, 1 nay, and 2 excused.
After receiving a majority of the votes, the motion to recall Senate Bill 6 is hereby deemed passed. At this time, we'd take a motion to adjourn. Moved by Hone, seconded by Colbeck. All those in favor say aye. Aye. Those opposed say no. We are adjourned.
When South Dakotans need reliable information, SDPB is there providing updates and coverage that keep our communities safe and connected. Good, useful, and full of wonder. SDPB. SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB. Good, useful, and full of wonder. From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts programming. Good, useful, and full of wonder. SDPB. Every day, SDPB connects South Dakotans with stories that inform, inspire, and bring us together. SDPB, good, useful, and full of wonder.